Good morning, Hawford Health Centre. How can I help?
You haven't told me how much you were drinking. I don't know if you want to.
No, because I'm always embarrassed when you ask me.
OK, well, I won't ask you again.
I was scared. I was scared of going to the gym. Don't know why.
What are you scared about?
I'm fat.
What about smoking?
Yes, I do smoke.
I mean, smoking does make you much, much more likely to get this kind of thing, yeah, unfortunately.
I cannot shift this weight. It's like just eat everything in the fridge. I don't even open the fridge. It's like I shoved the whole fridge in my mouth.
Resolutions can kickstart people in wanting to make some changes with regards to their health.
Perhaps stop smoking, take more exercise, spend more time with their family, do healthy, positive things.
Davis, please. Hi there, thanks for waiting. Have a seat.
Thank you.
Right, what can I do for you?
I've been swimming a lot. I started swimming three times a week because I want to try and shift this weight. I am really trying hard now. I sort of swim a good mile at least 3 times a week, aqua aerobics. I've got exercises from the physio for walking and that, but I cannot shift this weight. I joined Slimming World and I can stick it for a couple of weeks and then it's like just eat everything in the fridge.
What's your real downside, do you think?
Anything sweet, I will just... Oh, yeah. And it's not... I wouldn't think, oh, yeah, I'll have one of those chocolate bars. I'll have the whole packet and not feel bad about it. I actually feel good when I'm eating it, so this is the problem.
What we should all learn when we've got weight issues is about what we're putting in here, really. And
I know what I'm putting in is wrong.
Yeah, it's about a healthy eating plan. It's not about, oh, you can't have that. It's about, right, let's pick things that you really like and eat them well, and then things that...
It is good. I mean, I've done it before and it's really worked for me, but just this time it's like...
It can work again.
Yeah, OK.
Is there any way the Slimming World people can help you when those attacking the fridge moments come?
I don't even open the fridge. It's like I shoved the whole fridge in my mouth.
Yeah.
And it's almost like I need it. It's not, oh, I really fancy that. I need to eat it.
Right.
And I'm really, really struggling.
I think you're doing everything you can.
I'm trying everything and I'm really exercising, but it's just going on.
So exercise by itself won't do it. That's what they've guidance has said lately.
Yeah. I'm going back again tonight with my daughter because I was going and then I stopped. I thought I'm just wasting my time.
But it is good going and staying. Do you stay at the group?
Well, my daughter wants to tonight. She's put on a few pounds, so she wants to go and she'll be, I'll stay with you.
Everybody in these groups are in the same boat, aren't they? And if they're still losing weight, they might have ideas and techniques of what they've done to overcome it.
Yeah, OK.
Yeah?
All right. OK, then. All right,
no
lovely.
Problem. Bye-bye.
Thank you.
Hi there, come and have a seat. Hello, hello, hello.
Hi.
So, Jessica, I'm Dr. Lee. Now, what's the problem?
Hi, Dr. Lee.
Hello.
In school, I could feel this part of my nose really hurting when I touched it. So when I went home, I put something cold on it. And then today, after school, I told my dad to look at it because it hadn't stopped, and he said it was
swollen inside.
Swollen inside. OK. Listen, I'm going to look up your nose. How about that? Now, is it going to hurt if I put this in here, do you think?
If you press it, that's when it hurts.
OK, so I'll go very gently. Is that all right?
What do you see?
Nothing yet. Is that the bit that hurts?
Yeah.
Yeah.
Ow.
Oh. Just one leg.
OK. Well, that was a bit painful, huh? Have you or anyone in your family got sores on your mouth called cold sores? Do you have cold sores in the family? Yeah. So occasionally you can get a cold sore up the nose, and it is really painful. Now, that's not a dangerous thing, but what usually happens is it's sore for quite a few days, maybe a week. And then after that, you can get crusting in there that lasts for another 2 weeks, so maybe 3 weeks altogether. I can give you some cream to put in there. Now, listen, put a little bit on the end of your finger and just put it up your nose and rub it round that sore area 5 times a day. And you can do it maybe for 5 days. If it's this, I'm afraid it's still going to be crusty and sore for 3 weeks. We'll see you later in the week. It's a pleasure. Thank you. I'm sorry your dad did that to your nose. I look very sore.
Thank you.
Bye.
OK, bye-bye.
What do we need to discuss?
I think my ulcer's playing up again.
Just point to where the discomfort is.
It is, like, on my right-hand side, and every time I move, it just feels as if someone's giving me a right wallop in my right-hand side, right on me, like, my kidney side. But I have been under a lot of stress lately.
Was there anything obvious that caused it to come on, other than perhaps the stress?
My partner probably said I was drinking too much.
So, to be clear, was it after you started drinking that this discomfort came on?
Yeah, it came on, like, Sunday. Then Monday I was in discomfort, and then I made a decision not to go work on the Tuesday, and I haven't been in since.
OK. And what have your bowels been like?
Probably gone more than what I usually have gone.
Okay. Loose stools?
Yes.
Stools? Loose stools?
Yeah.
Okay. Any blood in the motions or anything like tar in the motions?
No.
And any urinary symptoms at all? Because, as you say, this is a little bit in the kidney area. Have you noticed anything with your urine?
Just going rather a lot.
All right. Should we have a feel of the tongue first?
Yeah.
Yeah, OK. Hop up on the couch.
Yeah.
So if you can lie up here. OK, lay yourself down flat.
See, that hurts doing that, look.
Does it really? Yeah.
Yeah.
So this is where you said you were feeling the pain?
Yeah.
That's sore. We come down here. You're gripping your teeth there, aren't you?
That was hurting there.
Yeah.
Yeah.
What about if I press in here?
That's it.
Interesting.
I'm not eating, but then I'm putting on weight. With all due respect, if you're really not eating, you're not very likely to be putting on weight.
I bet my BMI is 26.
27.
Oh, no!
You're coming out at a high body mass index,
Yeah.
which would indicate that you're overweight, potentially obese.
I was eating everything that I could see.
Yeah.
I'm 64 years old and I look like Mr. Blobby.
Have you joined Slimming World?
I put weight on.
Did you?
So I stopped going.
How long did you try it for?
3 weeks.
My wife's trying to lose weight.
Right.
And she's always going to give you these fancy foods like couscous and all that.
80% of weight loss is eating less.
It's like, can't I just take a pill? That'd be so much easier.
Come on in, come and take a seat. Yeah, it's not too bad, thanks. How are you? How can I help?
What it is, the bottom of my foot, the heel bit there, is swollen really bad, and I can't walk properly on it.
OK. And whereabouts does it hurt? In the heel?
Like, all in there, up there.
OK. When you wake up in the morning, is the pain OK? No.
It's the time it hurts is when I go to sleep, because you're asleep, you don't feel it. And when you wake up, sometimes I'm thinking, cool.
OK, so let's have a look. What might be easier is if you come and have a lie down up here, pop socks and shoes off and just come and have a lie down there.
Salty smell. Cool. Some part reason why...
Don't worry about that.
I did have a wash, but some part reason my feet keeps on smelling all the time.
That's all right, don't you worry. Got interesting legs, anyway.
Hey?
Interesting legs.
Oh.
So it's the right foot.
Yep.
Do you get pain in here?
Yeah.
It's just in there. So in that point there, when you put pressure on that area, does it hurt when you walk around?
Yeah.
OK. And if I press there, you've got the pain. Sorry. But in the back here...
Sometimes the pain does come up and
it comes up
onto
there.
it as well.
Come and take a seat. So 2 things. One is, it sounds a bit like what we call plantar fasciitis. OK. Underneath the skin, you've got a kind of fascia, or this kind of membrane type thing, and it can get inflamed. And it feels like someone stuck a pin in your heel. There's certain ways to just help it along. And actually, your feet could do with a little bit of support in the arches, because they're slightly flat. Swimming might help. losing a bit of weight might help.
I was just about to say that.
Yeah. We are doing, in the treatment room...
I'm scared. I'm scared of going to the gym. Don't know why.
What are you scared about?
So fat.
But if you went along to the gym, they can show you exercises that suit you. Because there's people of all shapes and sizes going.
I can't put... Oh, yeah.
Not be worried, because you're only 29, aren't you? So
I don't know why. I should not be scared, really, but I am.
Yeah, no.
Also, my friend goes, he said, mate, there's a bloke that's like 34 stone.
It's quite good to go with a buddy if you've got a friend that wants to do it with you. So go along, give it a go.
OK.
All right.
Brilliant, thank you.
You're welcome. Take care. Bye.
Bye.
I mean, I think there are several possibilities here, actually. Could this be to do with duodenal ulcer? Yes, it could. But the duodenal ulcer doesn't really explain the flank pain particularly.
Right.
We also worry about inflammation of the pancreas, which is, can certainly happen after heavy drinking.
OK.
OK. You haven't told me how much you're drinking. I don't know if you want to.
No, because I'm always embarrassed when you ask me.
OK, well, I won't ask you again. It's important to be honest with your doctor about how much you're drinking. After all, we are here to help you, but we can only do that if we know what the main issues are. Many people do drink more than is medically sensible, particularly over the festive period. So the new year provides a good opportunity for making changes for the better. So that could be a factor. OK, so pancreas could be a factor.
OK.
So we look for that with a blood test. I'd like to get a urine sample done off you now, I think.
OK.
And then we'll have another chat on the phone this afternoon once we've got results back.
That sounds fine.
Do you think you can go do the pee sample for me now?
I could try.
You're going to have a try. OK, there we go. You know there's a loo at the end of the corridor?
I do.
OK. So if you just go up to the end there and then back to room 2.
OK. OK.
Mary Penny? Hi there, come on through.
Hiya. Hiya. Thanks for seeing me.
That's quite all right. How can I help today?
This has been on my ear since February, and now it's started to erupt. It's opened. And I'm not sure what it is.
Yeah.
And it's not going away.
How does it feel?
It's quite sore when I lie on it at night, so I don't. It has a sort of burning feel to it, but then that could be because I've now just been touching it.
Any history of skin problems at all?
No, not really. I mean, you know, obviously at my age, all sorts of weird lumps and bumps form, and then they go.
Yeah.
But it's because this is persistent and it's in a sun-exposed area. I just sort of might just let someone look at it.
Yeah, no, absolutely.
It sometimes sort of prickles a bit, almost as though there's a sort of cactus spine in it. It's just a prickle.
It almost has a shiny quality to it, doesn't it?
I don't know, it's quite hard to see.
Yeah, I suppose it's a difficult area for you to see.
Yeah.
OK. Well, it certainly is a sun-exposed area, and I think we take persistent growth like this quite seriously.
OK.
What it looks most like to me is something called a BCC, which is it is a type of skin cancer, but actually, if you're going to get something cancerous, it's probably
on the good list.
On the good side, in that it's slow-growing, never invades other areas, so it doesn't spread anywhere.
Yeah.
And so it's something we deal with kind of on a much more routine basis.
Is it treatable?
It's something we would remove.
OK.
If it continues to grow, it can disrupt local structures like the cartilage, etc., in the ears, and become increasingly difficult to cut out. Does that is there any questions that come from that, or anyone?
No. I mean, it was just a case of I wanted to come in and find out what it was, because better the devil you know, really.
Yeah. People can sometimes put off coming to see their doctor about lumps or bumps. If you're worried about a lump, particularly if it's growing or changing, I would encourage you to come and see your GP about it. So, what happens next? It is important that you see a specialist. I think that's the first thing to say about definitive treatment, and I suspect that will be cut it out.
OK.
So I'll send a referral letter off.
No, that's great. I'll let you get on with your list. Thanks very much for seeing me as well.
No problem.
So was it painful when you peed then?
No, it's not painful.
I think it's going to be normal. I'll just let that cook for a minute. I'd like to take a blood sample. Can you do that now? Yeah. Well, actually, this is interesting. There is just a tiny trace of blood in the urine. Now, some people do get that for no bad reason.
OK.
But if we don't find anything on the blood tests, maybe we should think about investigating your kidney, which... OK. Most important thing is to check for the pancreas problem we talked about.
OK.
Also check your kidney and liver tests, and I'm checking your blood count as well in case there's any clues on all of that. All right. Great. OK, so that will be back by mid-afternoon. OK? All right, we'll speak later.
OK, thank you.
All right, cheers then.
See you again.
Bye.
All right, cheers.
I've got an appointment at 9:40 today with Dr. Pele.
It's 10:40.
Can I rebook that appointment with him?
Can't wait for it, no.
Well, not an hour.
What are you looking for?
It's all right, there's a little problem. I've got it wrong again. It's 10:40. I mean, I'm happy to do 10:40. It just means I've wasted my wife's trip down here and I can come back.
Look, I'm getting rid of him for a day soon.
Yeah.
He's going to his sister.
If he would like to see me at 10:40, I don't believe...
That'll be fine.
Very
All right.
much.
OK, thank you.
So I noticed that last time you came in, you saw Dr. McLaren, and he said he wanted you to have a chest X-ray. Did you ever go for the chest X-ray?
No, I didn't. I was so busy in work, I don't think I did.
So we need to get that chest X-ray. Because you've smoked for a long time, you could potentially have something called COPD, chronic obstructive pulmonary disease, and it's basically where there's damage to your airways, and that can sometimes mean that you get more chest infections regularly.
Oh, I see.
Right, if we can have a listen to your chest. If you pop your jacket off and your jumper as well. Right, nice deep breaths for me. And out. OK. So your chest sounds reasonably clear. There's definitely not any wheeze there.
That's good. That's good news.
You've got a few fine crackles, a little bit lower down on both sides, but nothing severe. Have a lean forwards for me. I'm just going to tap on your back.
OK. You know, I tried to give up smoking last week, and I carried on for 3 days.
OK.
And when I give up smoking, I become a very quick lose temper. You do not believe. I'm like a Spanish bull, having head down. I said to my wife, I'm going back. She said, I know, go back. You did before. You tried to give up before, I know.
So do you want to give up smoking?
I do.
We have specialist nurses that can help you to give up smoking, and all the evidence shows that if you have the help of somebody else, it's a lot more likely to be successful, and that
I think that's the best,
help.
yes.
With regards to your breathing now, I don't think you need any antibiotics, but we need to get you to have this chest X-ray. So I will book you on for the chest X-ray.
Lovely. Thank you for your help.
You're welcome.
Thank you.
Take care. Bye.
Thank you. Bye-bye.
That's yes.
Hiya.
Come and have a seat. OK. So we're having a look at your legs, aren't we, to see what's... So we did a scan to exclude a DVT.
Yeah, but no, I've got no pain at all with it, or aching, or burning, or... I went round the garden centres that Saturday, so a lot of traipsing around, and Sunday they seem to have gone
better.
down.
Interesting. Gravity will take fluid down to your feet and into your legs, and activity will bring it back up. I just want to check your blood results, because sometimes, you know, things within that can explain the swelling. So your albumin level, that was the thing I was interested in, and it's a tiny bit low, so it's a sort of protein in the body, and if that drops a little bit, you can get a bit of swelling. It's just under the normal range, so that might account for this swelling in your leg. But as I say, my main concern was if you're getting a blood clot, because with a cancer you're more at risk of blood clots. So having excluded that, I kind of, you know, then I'm not interested anymore. That's not true. Bradley has prostate cancer, which has spread to the bones. It had spread in this manner when it was diagnosed back in 2012. He's been receiving regular treatment from oncology during the past 5 years to prevent further spread of the cancer.
It was just the other night I had a terrible episode where so ill. Just felt so incredibly ill. But a couple of hours later, I was all right. Didn't feel sick. Didn't have any aches, but just ill. Yeah.
And you're actively having treatment as well at the moment, aren't you? You're having the radium...
223,
yes. Is your treatment once a week?
No, once a month.
Once a month, right,
yeah.
OK, so yeah.
So, but they're very good down there. I can't, praise, like, oncology and, well, all you guys are left, everybody's been fantastic. Unfortunately...
It's been a bit relentless, hasn't it?
Yeah.
It's one lot of treatment.
Well, I think Pam was a bit down the other day because it's hospital appointments and, she said, it'd be nice just to have a day off from all this, My main concern is, when I lose control of everything, I've accepted, I'm OK with it, I know what's going to happen, but... Initially, I said, I'll just stay home and die at home. But then seeing how much work was involved with that, so I said, well, I'll go into a hospice. And then the more you think about it, I probably won't get a choice, I know when I go out that door, I'm not going back.
Yes.
That's the end of the story. But then being carted off somewhere... strange, and I think I just want to go to sleep. Feel a bit rough one night, go to sleep and not wake up.
Yes.
What do you think all this might be?
I think it might just be stress.
OK.
I just thought it's due to stress, and it's just stress and stress.
Have you had any particularly stressful events or anything like that? Or...
I got quite panicky today. I was just sitting there and all of a sudden I'm like, I can't think of how to breathe right now. What's going on?
Are you stressed at work?
Life is stressed, but yeah.
Do you suffer with mood issues or anxiety at all?
Stress is something that's always been part of my life. I just feel like from one minute to the other, I start shaking. I feel like I'm going to collapse on the street.
I had a period of a lot of stress, so I started doing yoga, and I am feeling loads better.
Oh, that's brilliant. So you're actually sorting out your physical, mental and spiritual health, or, all of it.
They were saying it may be a bit of stress.
I know stress is a horrible thing, but it happens to all of us.
Yeah.
So, how are things going since we last met up?
Well, I've been doing a headache diary.
Have you noticed anything interesting or enlightening?
Well, mornings, it's generally either no headache or like a 2 or something like that, and then it just gradually builds up.
Yeah.
Went to the optometrist.
Yeah.
They said it's got nothing to do with your eyes.
Yeah. Are you still getting headaches all the time?
In the last couple of days, I've been waking up with no headache, which is something different.
Right.
I think this could all just be down to just work.
So, OK, what can you do to counter that, then, or balance that out?
One thing I can do is probably take a few more breaks at work, that's for sure. I tend to, a 13-hour day without even quibbling about it and just crack on,
What I see both professionally and personally, with friends and family as well as at work, is that I think people keep going, and then sometimes if you don't do anything, something gives, and you can get something quite serious, I think stress is implicated in a lot of illnesses, and quite serious illnesses, more physical problems as well. So I think it's really important to take note of it. Sometimes we get to a point when it's getting a bit too much, and I do think often that's when our bodies will tell us something, and say, well, hang on a minute, maybe you need to stop and address it and look at it. We know that stress is a big factor in many illnesses, both physical and mental. And we also know that many people are overworking, working harder than they want to, finding it difficult to switch off, and they haven't achieved a good work-life balance. In addition to that, we recognise that at Christmas there are a lot of additional stresses. For example, often being very busy and sociable, spending money that perhaps we don't have. So we recognise it's important after the Christmas and New Year period for us to rest, relax and recoup and perhaps reflect on where we're at and what's a good way to move forward. I appreciate often professionally it's difficult to change things, but I mean, do you think there are things you can change?
I've been having a chat with the bosses, and they're, also, you know, quite concerned about the whole situation. Got another person on board. We're trying to, you know, there's a lot of active stuff that we're doing at work.
And do you think that's going to work?
I think so.
I'm going to book you in to see me in a fortnight.
Yep.
Because I want to see how you're doing from the point of view of the headaches. All right.
Thank you very much.
Thanks, Dawn. Nice
Cheers.
to see you again. Cheers. Bye
Cheers.
now.
See you later.
Good luck with it all.
It's hard, isn't it? Because you're kind of you need to be planning in your head.
Yeah.
That the end is coming one day.
Yeah.
But actually, I want you to be living for the moment as well and enjoying what you have left.
I don't sort of dwell on it. I'm not depressed or anything. Sometimes I'll just sit down and write a letter to Pam or to the grandkids. Because that was another thing that sort of scared me, was being so drugged up towards the end. Yeah, I might not even recognise anybody. Yeah.
I think we never know. We just don't know what position people are in.
Writing things I want to say.
Yes.
Sometimes when Pam reads them, it upsets her. Then she's all right with it.
Yes.
Yeah, yeah.
For patients with cancer, our role is very important. We know the patient, we know their family, and we are often at the centre of the decisions around care. We prescribe with the assistance of the palliative care team. But we're also just there to offer support and talk through any concerns. Some people don't want to talk about the fact that they're dying. Bradley's able to talk about it, and he remains positive, pragmatic and realistic about the future. Have you got a will?
Yeah, that's all that. But
Yeah.
most, funerals paid for and all stuff like that. All in all, I'm pretty good. I'm, keeping. Well, I was going to say well. I'm keeping all right, Right.
Excellent.
Well, nice to see you.
Nice to see you too, and I will see you when you need me. Yeah.
Yeah, any problems, I'll
You
give
know
you
where
a
to find
bell.
me. Yeah.
All right, thank you very much. Oh.
Okay, see you again.
All right, lovely. Thank
Bye-bye.
you, Dr. Raj. Bye-bye.
Proceed. Right, how can I help?
I started to have a bit of a pain in my stomach and a bit of a cough, and I thought it might have been something I'd ate or something. It's kind of been rumbling over the weekend, but it's kind of changed. I've still got this cough, but now I'm getting this pain sort of up here, which radiates like my back.
Okay. And how long does it last?
Well, a severe one's probably about 10 seconds, but this morning it was really bad, and it was happening every 30 seconds. I'd have this weird wave.
And you're eating okay?
Yeah, eating fine, no sort of loss of appetite or anything like that.
Right, let's check you over and see.
Thank you.
Yep, it's completely fine. Be easier if you came over here.
Yeah.
You okay lying down?
Yeah, of course.
So I'm going to feel all over.
Yeah, that's fine.
And you tell me if I get the place where it hurts. It's definitely not more right or left.
No.
No.
Yeah, that's just there.
There?
Yeah.
Definitely there, right? I want you to take a really deep breath. I'm just checking your gallbladder. And then breathe out.
A bit.
That's a bit.
Yeah, just a bit there. And there.
There, definitely.
Yeah.
Come and sit down. Right. Your chest, your lungs and your heart all sound fine. Your blood pressure and temperature are fine.
Yeah.
I think what it is, you're really tender around the top bound of your stomach.
Yeah.
And I think that's probably what's happened, is you've probably got a bit of inflammation inside your stomach.
Okay.
And that's what's causing you all these sudden pains. I think you've got a bit of gastritis. Okay. Have you taken anything for it at all?
I've only been taking sort of Alka-Seltzer, paracetamol, just because that settles my stomach.
That's a good idea. I think what we should do is give you something a bit stronger, something called omeprazole, which is a tablet to take 1 a day for a month, and normally that gets it better pretty quickly.
Yeah.
The other thing is to alter your diet a little bit. The sort of thing that makes this bad is things like curry, spicy food, very acidic food, and alcohol.
Yeah.
What about smoking?
Yes, I do smoke.
Okay. A lot? Or a
No,
bit?
not really. Probably about 10 to 15 a day.
Yeah, I mean, smoking does make you much, much more likely to get this kind of thing, unfortunately. Have you thought about trying to stop?
I have tried to give up before.
Yes.
It's just proven difficult, and I've had a vape, and I've tried the patches, but I had a reaction to the patches, so I couldn't try that. The chewing gum was quite good.
I mean, a lot of people have to try quite a lot of times before they get there in the end.
Yeah.
But it doesn't mean to stop trying.
Yeah.
Right, so I've sent that to the chemist.
That's great.
Thank you very much for that. Bye-bye.
Bye.
Okay, come and grab a seat.
Thank you very
yeah,
much.
hello there. Your mum, aren't you? Yeah, drag up.
Thank you.
Okay. Okay, what do we need to talk about?
Oh, God, everything.
What's the most important things we need to talk about?
I've been trying to lose weight and I've got like ME and stuff, so it's obviously difficult. I've been sticking to like 1,200 calories a day.
Okay, well done.
And I've also like had to go to physio for my shoulder, and there was like exercises they gave me to do, which are like daily. So I've been doing them, and I've managed to up it a bit and sort of add in like a sit up here and there and some squats, and but I'm just gaining and gaining weight.
She's just very hard on herself. She works extremely hard and she exercises every day. And before, if I said this time last year, she'd have lost the weight a couple of weeks down to her, not skinny, because you're not a skinny person, but she'd be fit and she'd feel quite able. But she's doing the same things, if not more, and she's not losing anything. And also her moods are awful.
That's
to the point that it's like, I'll move out. I'll live with the cat in the little shack at the end of the garden, because it's like, it's really like walking on eggshells. Seriously, it's like.
What did you think of that? What Mum just said?
It's fair. I suffer from depression, and as soon as it's like moods, it's like depression will get you back on the tablets. And I don't feel that I'm anywhere near that headspace that I get into when I'm depressed. Like I don't feel. I'm not crying at co-op adverts. That's always the signs. But I am definitely like, I'll sit there and then Mum will say something, I'm like, like hulking out. And there's no need for me to get angry. But I don't think it's depression.
No, I mean, I must say, I don't get the impression that you're depressed from the way you're talking and from the things that you're saying, actually. So you may sometimes be irritable, but that's not quite the same thing.
Yeah. But I think the weight at the minute is your biggest issue.
You told me that you're being careful with what you eat, you're keeping to a low-calorie diet.
Yeah.
And you've talked about your weight going on.
I was 13 stone last week, and I'm up to 13 and a half when I weighed myself yesterday.
In just under a year, you've gone from 78 to 85.
Yeah, it has sort of
Which obviously is a
ballooned.
significant weight gain. I mean, a couple of things. One is if you can learn to eat slower. A lot of us are wolfers, aren't we?
Yeah,
you know,
I definitely think I'm a wolfer.
You put in too much before your brain says, hey, I'm full. Make sure you put your hands down between each mouthful. So you take a mouthful, put your knife and fork down, sit on your hands.
Okay.
You finished it. Then take the next mouthful.
Yeah. You're so going to have to get on me about doing that.
Well, but everyone can do it, can't they? That's a top tip. Another top tip, which I expect you've done already, is to use a smaller plate.
Yeah.
Use a side plate instead of a large plate. And don't come back for seconds.
Once I leave that kitchen, I'm out. No going back. Yeah.
So is that helpful?
Yeah. Cool.
Okay.
I will start doing that. Thank you very much.
Yeah, let's do it. Okay.
Oh.
Cheerio then. Okay.
Thank you.
Bye-bye.
Bye.
How can I help?
My wife's nagging me about a possible vasectomy.
So what's made you think that would be the right thing to do?
I don't want any more children.
Right.
I'm married. I got 2 children, 2 little
Yes.
boys. Financially, physically, and my wife as well.
That's enough.
We always said we'd have 2.
Yeah.
People question because we've got 2 boys. You know, you might want a girl. It's like, well, yeah, I'm right.
Yeah, fine. And at the moment, what contraception are you using as a couple?
She's having trouble with the pill that she's obviously making her quite ill, so
Right.
we're using condoms and stuff as well.
Okay.
And she's going to have an injection, I think, in the next couple of weeks, I think,
Okay,
potentially. But
fine. So the situation, interestingly, has changed a bit about referring for a vasectomy now.
Okay.
So in the past, until very recently, I would have just referred you for a vasectomy because you want one.
Yep.
But it's changed now that we now need to have tried other methods of contraception, mainly that the women use, obviously, because there are no other methods for men apart from condoms. And they have to have been unsuitable before we are allowed to refer you for a vasectomy.
Right. Okay.
And the reason for that is quite sensible, actually. When a woman is using contraception, she also gets some non-contraceptive benefits.
Right.
Like periods can go on the injection, so that's quite nice.
Okay.
Or can become less heavy if you're have a particular sort of coil
Yeah.
or the pill.
Yeah, because the pill she's on at the moment, she has quite, like, every couple of weeks, and she's having quite a lot of pain
So that's
with it,
really
which
not
is why...
working for her.
No, and it's
Yeah.
it's not for a while now, I don't
Yeah.
think, not probably since
So
we've
I
had
think
our
it's a really good idea for her to try the injection. And
Right.
if that works for her as a method of contraception, then what has been decided in this local area is that that will be the method of contraception rather
Right.
than you have a vasectomy. And the other good reason for that is that having a vasectomy is actually an operation and
Yeah.
has some small risks associated with
Yes,
it.
of course.
And so that are more than your partner having the depot injection, OK?
OK.
So what I suggest is that she has a go at seeing how the injection goes.
Yeah.
If she's unhappy with that as a method of contraception, then she should come back and see her own doctor and talk through other options.
Right.
And then once all the options are tried for the woman, if they fail, then we can refer you for vasectomy. So we have tried to refer a few people who haven't tried the depot injection and haven't tried a coil, and it's been rejected.
Right, OK.
OK?
Okay,
All right,
thank
then.
you very much.
That's OK.
Thank you.
Bye now.
Goodbye.
Barry Thomas, please. Have a seat.
Thank you.
Right, what can I do for you?
What it is, first of all, I got fluid on my leg.
So when you say you've got fluid on your leg, what do you mean exactly?
Well, it's like... See?
Right, OK. So I think what we need to think about is why they're a bit swollen.
Well, I think it's the... Sorry, I'm out of breath.
Yeah, so take your time.
Yeah.
Catch your breath a second.
Right. I think it's the blood pressure tablets normally do it.
OK. Catch your breath.
Yeah. Because I'm on that.
OK,
Yeah,
calm
right.
down.
All right, OK.
I'll have a look at your medication.
Yeah, yeah.
And you take a break.
Do you smoke at all?
I do, yeah.
How many a day?
Probably about 15.
How many years have you smoked?
Since I was 17.
So about 40 years.
You're not a smoker?
I'm a smoker.
You are a smoker?
Any plans of stopping?
I have tried to stop. I tried to vape. I just can't get on with it. I really can't.
Have you got any thoughts about trying to stop
I do
that?
want to quit, yeah.
Just not going to well part at the moment.
I tried the patches a few years ago and put it on my arm, and it just burnt on my arm and like near enough blistered up. So I was like, oh, let's go in.
I'm not ready to give up, really.
Why is that? What do you think would need to change for you
I
to...
don't know. I just enjoy it.
And the chewing gum tastes horrible, and the thing you suck on tastes horrible. And
Come and see someone in the treatment room.
I'll try.
Because they do some magic in there.
You are smoking, aren't you? Which obviously it would be good to cut back on the smoking. I don't know how you feel about that.
No.
So you've got diabetes, you've got COPD.
Yeah.
Blood pressure.
Yeah.
And was it a heart attack you had in September 2015?
Yeah.
Yeah, OK. And then I'll have a look at your blood pressure. You're on a bit of a cocktail. Right, you've got your breath now.
Yeah, yeah.
OK.
Yeah.
So tell me how long this has been a problem.
Weeks now, probably weeks.
Okay.
If I try to do any walking,
Yeah.
right, OK,
Yeah.
then it swells, swells up
OK.
again.
And is it both legs?
I don't know, no, this one ain't so bad, because I got chicken legs anyway, but, you know what I mean? Sorry.
It's all right. OK. So what about your breathing?
Yeah, my breathing's because the thing is, see, I stopped smoking, right?
Well done.
But I start again, right? I can go 3-4 days cold turkey, not worry about it.
Yeah.
And then, for some reason, my breathing gets better,
Mhm.
right? And I'll smoke again, but I'm still battling it, right? Do you know what I mean?
Keep battling it.
Yeah. Oh, yeah, I got to, because
So
I
when people
feel so
first-
much better when I
Do you?
stop smoking.
Because when people first stop smoking, the tiny little hairs in the airways that have deadened with the cigarettes start to come alive again. And they
Right.
work and start to bring the muck up again.
Right.
All right? So it can get worse before it gets better. Are you coughing anything up?
Yeah, sort of greeny phlegmish. Yeah.
Any chest pain?
Little bit of discomfort, I guess. Most of the time is when I smoke.
When you smoke?
When I smoke. If I don't smoke,
Right,
I don't
so
get
that's the thing.
I get no pain.
Right.
I don't stress about it. I don't
Okay.
start thinking about dying and all this stuff.
Okay.
I'm like, you know what I mean? It's like
Right, let's have a little look at you. Let's check your blood pressure. So to stop the cigarettes, have you seen our nurses for help?
No, every time, it's like weeks away, isn't it? And every time...
Yeah, but the thing is...
Every time I go there, every time I got to see her, I've already stopped.
Yeah, but the thing
and
is,
then I don't,
if you do it with their help, you're more likely to stay off the cigarettes.
Yeah.
All right?
You're right there, I know that.
So keep your arms straight.
Right.
OK, bit high. OK, let me have a little listen to your heart and your chest, OK? Can I pull this up?
Yeah, of course.
Deep breaths. And out. OK. Let's have a look at these legs. Right, if you pull your trousers up. Right, OK. I'm going to give you some antibiotics because you're coughing up green muck. You're a bit breathless.
Right,
all right?
Yeah.
I think that's related to the smoking, OK? But I think we need...
both know that,
But I think we need a bit of an MOT. I think what could be happening, your heart could be struggling a bit to pump all the fluid around, and that's why it's accumulating on the legs. All right?
Okay,
So I think we need an ECG, bloods and a chest X-ray to help us work out if there's some signs of heart failure.
I thought you was going to call it ambulance. I thought it was like dancing along.
No,
my God,
you're not that bad yet,
Not that
but
bad
let's
yet.
get things better.
All right, cool.
All right?
All right, thank you.
No problem. Nice to see you.
And you.
Bye-bye.
Thank you.
How are things? What are we talking about today?
Good things and new things. Good things is that I've been able to dramatically change my situation at home, finally.
Excellent. Much better for you.
And then I've started to make goals that are achievable in the short, middle, and long term, which is really good. Actually, I don't think I've ever done that in my whole life. The first one, the now was the house, obviously, to make my environment livable again. And the middle term is I've had this idea in my head for many years of making a drumming ensemble of many different drumming culture, like world music, all in one place.
Sounds fantastic. Yeah.
So that's going to happen, which is amazing. And in the long term, I've already asked for a couple of prospectuses from the Open University because I need some intellectual stimulation so badly.
That's brilliant, George.
Thank you.
And I wish...
I take it as a compliment because it's really been difficult to get to this place.
You said to me last time that you're not going to take the antidepressants and we're going to look into how to manage things. So you've done that for yourself.
Yeah, definitely.
Found out what your needs are and go forward.
And I feel really good, especially mentally. I'm in a really good mental space where I've been eating fish every day, and it's kind of given me some clarity, I think, some sharpness or something.
Your blood tests, kidney function, blood count, liver function, lipids that they did at the Brecon unit are all fine. So a lot of symptoms have settled down that we talked about last time. We've come a long way, and it's fantastic to see that. So I'll leave that up to you as to when we touch base.
Okay.
So that's a list of things that we've talked about today. But I'm really happy with your short, medium and long-term goals.
Me too.
That's brilliant.
Me too.
Good. Nice to see you, George.
Likewise.
Good. Take care.
Okay, bye-bye.
Bye, George.
Thank you.
All right. Bye now.
Thank you very much for your time.
Okay, no worries. My New Year's resolution is to address my work-life balance. I'd really like to finish work in time to get home for my son's bedtime.
I've always thought about joining an amateur dramatics society, and next year may be the year that I do that.
Thank you so much.
No problem. OK, all the best.
My plan for 2018 is to run London Marathon.
That's lovely, Doctor. Super. Thank you very much indeed. Appreciate your time.
In 2018, I plan to spend less time online and more time with my family and doing things outdoors.
best thing about being a GP. You just don't know when you're going to see something that's quite rare, quite interesting, and when there may be something quite serious coming in.
We need to get you seen by the hospital specialist. You need to make sure you're not missing anything.
Baby Frankie's having a heart operation because he has a hole connecting the left and right sides of his heart.
We have oxygen for him at home.
Yeah?
He's been in hospital for the last, 2-3 weeks.
The best thing about being a GP is the ability to help people and what you get back from patients.
How did it happen?
I pulled the door shut right on my leg.
Oh, I see.
Slammed it.
Oh, my.
I'm in agony, I tell you. I've got all that hair. Every time I was trying to get some sleep, my back was popping like bubble wrap. (9) It should have been.
So this is 10:50. That's 10 to 11.
Is that here?
Think so.
Gloria Wright, please.
Noisy down there today.
Hi, morning. Come and have a seat.
Thank you.
Right, how can I help?
I've seen David Ward about this.
Right.
And he gave me some steroid cream,
Hmm.
but it's done absolutely nothing. It's me ear.
Okay.
It's sort of bubbly, but it's really sore.
Okay.
And keeps waking me up. Because I normally sleep this side, but when I turn over, I don't know.
Right.
And I just want to get rid of it.
Okay. How long have you suffered with this?
It's been about 2 months.
Okay. Let's try and see if I can help you for this. So there is a sort of a dry area, and that's tender, is it? When I touched it. Okay. And then is this tender at all? This bit here? No. Okay. Just check behind your ear.
It's literally just that little bit at the top.
You can get these sort of hard, because you've only got cartilage, very, very thin skin in that area of the body. Can I compare to the other ear?
You can. Let me get my hair out of the way.
So you can get sort of this development of these sort of horns sometimes.
Don't say that. People
Not that
already
it's gonna get
think I'm
bigger.
a witch.
No. Okay, so what you had was a weak steroid. Do you remember I gave you something called Elacon in the past?
Yeah.
Did you apply any of that on there?
No.
Okay. It's not definitely going to say it would make it disappear, that sort of hard area of skin, but I want to see if it makes a difference. I'm hoping that this is more an inflammation of the skin sort of at this stage. I think it was suggested it could be a wart, like a seborrheic keratosis, but you can get this something called chondrodermatitis. It's a long name, nodularis helicus, where you get this sort of dry, hard bit of skin. In extreme cases, they can cut them out and do things, but we'll try the Elacon once a day. So there's some information there. That's useful, actually printed out.
Lovely.
All right.
Great.
So if you're not happy, come back and then we'll meet again.
Brilliant.
Yeah. Nice to see you.
Thank you.
Take care.
Dr. Shree. Have a good day.
Thank you. Bye.
How can I help today?
Basically, came for a GP appointment with Dr. Mackey. What happened was, so came in found spots of blood in my urine, and then went for it. She referred me to the urologist, and there was a tumour. I had a tumour in my bladder. I think it's cancer and everything. But, I had it taken out.
You've had it taken out?
Yeah, I had it out on Friday.
And when are you seeing them next in terms of getting the results of the biopsy and things?
18th of this month.
18th. Okay. And has the blood basically resolved now, or?
Blood. Well, no, even that hasn't. But that's more because I've had a.
You had a camera in
a
procedure.
The thing out. So.
Fine. And you've been off work, is that right?
for this.
Yeah.
Yeah. How long have you had off work for this so far?
Well, I had a couple of days off holiday anyway, so I've only actually taken Friday off sick.
Mm.
So,
and
it's just where I've got like an active job. I feel all right, but...
Are you planning to take more time off? Are you going back to work? What are your plans?
If it was like a office job, I'd probably go back next week, but where I'm an electrician, like, I don't know.
It's a bit more physical.
Yeah.
Yeah.
I just don't want to like I feel all right, but I don't know.
Should we sign you off for a week?
Yeah, sure.
And then go back and...
Yeah.
I mean, obviously, any further treatment depend on the results, really, of what was taken out. All right, we'll see how it goes on the 18th. Take it from there, really. Yeah.
All right.
It's unusual finding in a 30-year-old, I must say.
Really?
Yeah. I'm sure they've told you that in the hospital as well.
Yeah, I know.
So, it might be benign. We don't know that, really.
So, yeah, hopefully it isn't. But the thing I'm not looking forward to is like every 3 months having a cystoscopy. Like, it's absolutely filling me with dread, but it's got to be done, isn't it?
All right, you take care of yourself. All right.
You.
Hello, Terence.
Hello, Dominic. Can somebody sort something out about your toilet?
What's wrong with it, my love? We don't even get a chance to go in there.
No, it pinched my bum. With all the money they're going through here, you could at least afford a new toilet seat. I'll buy it. My toilet seat's broken.
Right, we'll put a note.
Pinched my bum.
We'll report it.
I'll report it for you.
After we've all sat on it.
My bum pinched for years.
Hi, come on in. I think I've met Frankie before. I think I came home to see him once.
Everyone's met him.
Yeah.
Everyone.
He's Mr. Popular.
So, he's been quite sleepy at home, got sleeping quite a lot.
Okay.
He hasn't done any poos in the last couple of days.
Okay.
And we have oxygen for him at home.
Yeah.
He's been in hospital for the last 2-3 weeks. With his mum.
Frankie's suffering from a genetic disorder called chromosome 3p deletion syndrome, which is a very rare genetic problem. Genes are the bits of code that make us who we are and tell our body how to grow and develop. And unfortunately, in Frankie's case, he's missing some of this code, which can lead to some problems in the way that the body functions.
Yeah. And it's christening on Saturday, so we just want to make sure things are nice.
Yeah.
So we don't miss it.
Of course, yeah.
He's supposed to be having his open heart surgery next week.
Right, okay. Okay, so a lot of important things coming up.
Yeah, but I'm not sure if that's going to go ahead because Great Ormond Street said they haven't had the pre-op assessment. And I think people haven't spoken properly and it's been sort of screwed up.
I guess it's quite a complicated case, isn't it? So there's lots of people who need to speak before this sort of thing happens. Okay.
Baby Frankie is having a heart operation because he has a hole connecting the left and right sides of his heart. He also has a narrowing of one of the arteries that leaves the heart, and so this needs to be surgically repaired.
I believe she's got a urine infection or something. Looks at the symptoms online, Dr. Google. Yes.
Have any problems when you're passing urine?
No, but it's just stinky.
Right, okay.
Can you go and do a urine sample for me?
I can try, yeah.
When was the last time you opened your bowels?
Because when she wheezes, she cries, and she was like holding this area here.
Very lucky that the loo is just opposite. Okay. See you in a second.
Right, so we're going to do your diabetic bloods?
That's correct.
Yeah. Did you bring a urine sample with you?
Well, can I tell you something now?
Go on.
I was about 2 or 3 weeks, well, 2 or 3 appointments ago.
Yeah.
I brought my urine sample, and I was told you don't need that. Oh, why don't we need that? Well, we don't do it anymore. Now,
I think it's a case of the blood work. We grab everything from the blood work, and obviously we do use the urine to check the glucose in the urine as well. I think the urine is more sort of old practice.
Correct.
But it's still a practice we like to do. So.
Well, I'm damned.
Yeah, essentially. I mean, it's always good to have the urine sample.
Well, yeah, I would agree with that.
Yeah, I would like a urine sample if you could do one for me.
Well, I'll give it a go.
You a ball, yeah.
Well,
do Do you want to go after and we'll do the bloods first? And,
Well, you
yeah?
can do. I don't mind. But you've got to be doing something, haven't you?
Right, OK, let's grab a pillow. Pop your arm on something.
You assumed I was going to give you my left arm.
Maybe. Closest to us, but there you go. I saw this big bulgy vein and I thought that's what I'm going for.
You're not going to sink your teeth into it, eh?
No.
No, all right. Do I get a sweetie after this?
Yeah, and a bag. I got a badge as well, sharp scratch. Little sticker. So, if I give you a bottle, maybe you might need to run the tap, who knows?
Where's the toilet? Out there or somewhere?
Yeah,
is
just go past the waiting room and it's just there on your left.
Oh, right.
Big handle. All right?
That's all right, mate. I mean, I remember compared to what he was like when I last saw him at home a few months ago, he was really struggling with the breathing and it was like really rapid. But the breathing seems a bit more settled compared to the last time I saw him.
That's good. That's what I want to hear.
Chromosome 3p deletion syndrome is rare in itself, but Frankie actually has a particular type of deletion called 3p25, which, if you look at the literature, only 50 cases have been reported since the first case was found in 1978. The most common problems include difficulties with breathing, which we saw that Frankie had, but also some structural problems with the way that the heart forms. There are also difficulties with feeding and gaining weight, and later on in life there can also be difficulties with learning and behavioural problems as well.
Like I mentioned, I mean, compared to the last time I saw Frankie, his breathing actually isn't that bad.
Yeah.
I think he does tend to sort of suck in a bit from what I recall of seeing him, and that seems to be his normal. But actually, at the moment, his temperature's down, and actually, in terms of his symptoms, I think actually he's doing all right.
That's good.
Obviously, if at any point he does develop a fever, or you're worried that his breathing is worsened, then obviously we can see him as an emergency. Or you can, ring 111 if it's out of hours. Okay.
The long-term prognosis, it will be a challenging course for Frankie, undoubtedly, but he's got specialist input and he'll have the right sort of care right the way through his development to ensure that he is able to live as fulfilling life as possible.
Thank you very much.
Yeah?
Good man. Does that sound good to you? Yeah?
Yeah.
I'm going to tell your mum. Ooh. Cheers, mate. Thank you.
All right, take care.
You too. Bye-bye.
Bye-bye.
The doctor's told me I need an appointment in 2 days' time.
Oh, you'd have to call on the day.
Everything's coming out.
What are you doing? You could have got it from the front. And then you can put it back at the front.
Mr. Victor Dell? Hi. Have a seat.
I'm out of work a bit quick, so sorry I'm a bit dirty.
No, that's okay. That's no problem at all, sir. I'll just introduce myself. My name's Vijay. I'm one of the clinical pharmacists of the practice. I've just brought you up. So you're here for a medicines review, sir?
Am I? Okay. That's what you say.
Okay. So you take a few different medicines for different things. Diabetes, blood pressure, cholesterol. Is that correct?
You say so?
Yeah. I think, yes, some of your medicines have expired, so that's probably why you're here for review as well. In terms of your medicines, how have you been with those? Are you taking them regularly, sir?
Yeah, every day.
Yeah, okay, brilliant. Now, diet-wise, are you conscious about what you have, or...?
Don't tell me to lose weight, because it's not happening. Tell you that now.
Okay.
I don't eat that great. I eat fish, chicken, diet drinks if I have any. Trouble is, I can't exercise. I've got nerve damage in both my legs, which I go to the hospital quite often to have epidural jabs with steroids in and that.
Okay.
I just can't swim, I can't ride my bike now, I can't go out for long walks.
Okay.
Can't do sit-ups, nothing like that, so...
All right, so that you got restricted with that.
It all depends what goes in my mouth.
Yes. Do you have alcohol, sir?
Yeah.
How many?
As much as I can get down my neck.
Do you smoke?
I do, but I've got onto the vape, and I'm down to about 3 now.
Okay, so you're looking to cut down.
Yeah, I'm trying to stop completely.
So we need to kind of look at how we can bring this blood sugar down. Try and stick to fiber and stuff. It's more filling, it's more healthy, saturated fats. From a tablets point of view, gliclazide, we could probably look at adjusting the dose to see if we can bring the blood sugar down. After that, we would probably have to consider insulin at some stage. I don't know what your thoughts on that is.
No, I'd rather go without that.
Yeah, yeah, no, it's...
It ain't going to happen. I only live once. If I'm going to die next week, I'll die. Don't worry about it.
That's fine.
Definitely.
Okay.
I've got to be on death's door to take that, and I might only be here for another 5 years anyway. I'll be in my box by then.
Okay, not to worry. I'm sure you live much longer than that.
I very much doubt it. You don't live with my wife.
Okay.
There are 2 people who are due to arrive from me at 2:15. I'm just going to visit and I should be back.
Okay, John, that's waiting room for you.
Or in the boardroom if it's empty by that time.
Dwayne Fernandez. Come in. How can I help?
Give me 1 second. Doctor, as you know, I'm diagnosed with Crohn's disease.
Yes.
Okay. I used to see Dr. Diore regularly. She wasn't available today, so I've come just to see herself today. I had 5 periods of loose bowel movement over the 2 days yesterday. Yesterday was 5 a.m. and 5 p.m.
Yeah.
And today was all in the morning, 3 a.m., 5:30 and 8:30 in the morning. A bit concerned, obviously, because that has just come about now.
Yeah.
I'm on steroid medication, and that's prednisolone after being discharged from hospital. I've got letters here.
Crohn's disease is, in essence, an inflammation of the bowel. It presents generally as diarrhea, and sometimes blood in the stool, a bit of weight loss, abdominal pain. It's a difficult condition because there isn't actually a cure. I think we're betwixt and between here. Do you understand what I mean? We're waiting for starting the new medication called Humira.
Humira, Humira.
Yeah. And I think that's good news because it sounds like your Crohn's is not properly controlled at the moment.
No.
We need to wait, okay, until you start this. When patients are under the care of specialist teams, if they come to see the GP in the middle of this, it can actually be quite difficult. You want to give the specialist team free rein to manage. That's why they've been referred in the first place. And so there can be some difficulties when managing patients in those circumstances of shared care. The problem with Crohn's is when it's not behaving itself, it can be very difficult for patients. And I think we need to wait until it's...
Wait for the blood test results and then see how that's going.
Yes.
All right, sir.
Okay. Any worries, come back and see us.
All right. Okay.
Okay.
Thank you very much, Doctor.
Cheers. Take it easy.
Doctor.
Bye-bye.
All right.
Bye-bye.
Have a nice day.
Bye-bye.
Come in, grab a seat, Mr. Hiles. I've got a student with me today, if that's all right. Grab a seat. Right, what can we do for you then?
My knee is getting worse, my osteoarthritis.
Uh-huh.
The painkillers I'm on just ain't doing nothing. I can't work or nothing anymore.
What do you do for a living?
Bricklayer.
Right, OK. So you need to sort of use yours. Is one knee worse than the other?
Yeah, it's only in the left one.
It's only in that one?
Yeah.
Did you injure that one in the past or anything? No. OK. And
you know when you get a toothache and nagging.
Yeah.
It's like that constantly.
If 10 is 10 the worst pain you can imagine, and no, it's no pain. Where does it lie between those two?
Well, I'd say 9.
9.
Yeah.
And when does it get worse then?
It gets worse when I bend my knee.
Yeah.
When I'm upright, it's fine.
Okay. When you're walking, is it okay?
Ain't too bad, yeah.
Yeah.
But it does nag.
Can you just slip your trousers off and let us have a little look at it and see? Okay, let me have a look at this one too. Oh, right, let me just see. Right, just relax for me. Relax, okay. Oh, sorry, yeah, we can get that. So.
It tends to hurt
up around here, does it? Yeah. Okay. Up that way?
Up there as well, more.
What painkillers are you taking at the moment?
The last ones they give me, I've taken them, but my wife says it makes me irritable, moody, and it don't agree with me whatsoever.
We gave you some cocodamol, but also some tramadol a while back.
That's right, yeah.
The tramadol can make people a bit sort of strange, a bit funny, a bit irritable.
She said it was making me irritable, nasty, and aggressive.
Do you get problems with your stomach or anything?
No.
Okay. It's been a while since you've had your knee x-rayed, so we'll need to get another x-ray and then we can look and see what we need to do. Let's get you some pain relief and then we'll review the whole thing together then, okay?
Thank you very much.
All right?
Thank you very much.
Okay, take care then, and we'll see how you get on. Okay, look after yourself. Bye-bye.
Susan Edwards, please. Hi, Susan. I've got a medical student with me today. Come on in.
She's got to learn.
Thanks for waiting. Dr. Tawana, nice to see you. I think I've seen you guys before, yes. How can I help today?
I keep getting headaches.
Okay.
I've had, is it, I don't know, MRI.
Okay.
This side doesn't really want to open. They admitted me last June because
Yes.
they thought I had a stroke.
Yes.
It turned out they said I had a Horner.
Right. Horner syndrome is where you've got a trio of symptoms. Those include one of your upper eyelids drooping, you have constriction of one of your pupils, and you can also get loss of sweating to one half of the forehead.
It's come back again. I've had a headache now since Sunday.
Yeah.
The weakness has come back.
Right.
I can't. I'm a mess.
So, important questions that I need to check with you. Any fevers, any rashes that have come out of the blue? Any vomiting in the last few days? Good. This headache that you've been experiencing, allowing you to sleep at night? Waking?
Sort of.
Sort of, OK. With Horner syndrome, there can be lots of different causes. To name just a few, you may be thinking of things like multiple sclerosis, tumours in the brain, inflammation of some of the arteries of the brain, herpes, zoster or shingles type infections. My immediate thoughts would be, I think we need to get you seen by the hospital specialist, just because potentially we need to make sure that we're not missing anything.
Really serious accident on a Thursday. I got my legs crushed.
I've got sewing machine on my foot.
Okay.
Stitches.
Oh.
Right, where in your legs?
Had some knee surgery. To my right leg.
My legs both are injured.
Okay.
And then where are you getting the pain? It's just around this top bit.
Got some bruising?
I'm still on crutches. Yes. This is the first day I've been off crutches.
Oh, that's good, yeah.
Lovely legs. That was my favourite bit, my legs. That's the worst bit of me.
How can I help?
Right, well, first off, it's actually, since I spoke to you, it's gone down, weirdly, but it has a lump
Okay.
just underneath there. It was the size of about a 10p piece.
Okay. Okay. And did you have bruising over this, apart from this one? Did
Oh,
you have
yeah,
any
it was
other
great,
bruise?
huge black.
Oh, how did it happen?
Well, you see, we left the motorhome site and we forgot to turn the gas off, so she stopped. I got out and I pulled the door shut, and I pulled the door shut right on my leg.
Oh, I see.
Slammed it.
Oh, my.
Yes, it was rather loud.
Trauma.
Yes.
Yeah.
So the lump was sort of quite big.
How long did it take to swell up?
Well, it sort of did it straight away, practically.
okay.
So,
So that's a hematoma. Yeah. So that's a collection of blood,
Right.
and so it's getting smaller all the time.
Yeah.
Yeah. And it's still there.
Yeah.
But it'll eventually get small. You might have a little nodule left at the end of it,
Yeah.
just as kind of this marks the spot
This marks the
which you
spot
shut
where
the
you
door
shut
on your
the door
leg.
on your leg.
Did you rest it or put ice on it, or what did you do?
Well, no, because we didn't have the sort of ice or anything like that. So I was just sitting in the cab
No,
in
I see.
pain.
Well, any form of ice, even frozen peas or frozen vegetables,
Yeah.
go into Tesco, take the frozen vegetables, but you have to
just sit in the
buy
fridge.
Buy them, yeah. And
Just a minute.
Yeah.
Don't mind me. I'm just.
Yes, I'm just treating myself. My doctor said I could do this.
Yeah, I could go into Tesco's.
Yes, no, I'd advise you to buy them first, and then you use them.
Okay, that's a good idea. Next time I do something stupid like that. All this typing, you haven't learnt to do it with more than one finger, then?
No, sadly, you're pointing out one of my inadequacies.
Well, you obviously haven't got many, you see, so...
I was going to say one of my many inadequacies. Yeah, you got there before I did.
Okay, brilliant.
Nice to see you.
I'm going to just check some of the nerves that come off the brain, just to see how they're functioning. So what we're going to get you to do, focus on my finger, and as I move the finger in closer to you, just keep following the finger. Here we go. Great, OK. Now, keep looking at the finger. I'm going to steady your head. Keep following it, just your eyes now. If at any point you see double, please let me know. Good. 2 up here. OK. clenching your jaw shut. And then open and clench. Good. Can you hear this? Yep. Okay. There is that little bit of weakness around the eye muscles on the right-hand side there. You're seeing double in the corner of that right eye. Are you happy for me to speak to the hospital team? I think we need to get you seen. And it does sound like it could be a Horner syndrome, I think, the Horner syndrome again. Yeah, you had that last year.
Put me in overnight.
OK, fine. Oh, hi, my name's Dr Tawana, GP at Farnham Road Surgery, Slough. I've got a patient, 60-year-old, in the room with me, just a bit concerned about a headache that she's developed. That's lovely. Brilliant. Thank you very much for your help. Cheers. Bye now. OK, so I'll do a kind of a referral letter. They will see you in the ambulatory care department, which I think is next door to the A&E department, so if you go straight there. Today, yes, they'll be expecting you.
I haven't wasted your time by coming.
Not at all. No, definitely not. We need to get you checked out and seen. OK, good luck up there. You're welcome. You're welcome. Take care.
Good service?
Yes, it's a good service.
Kept you waiting, but we got what you needed in the end.
I've been up here, well, this one is nearly 46, 47 years with the Farnham Road.
And today is the best service you've ever had.
Oh, good. Very good. Everybody is nice to talk to. I used to bring them some sweets up here because I worked in that one.
Oh.
Yeah,
We don't need sweets.
Oh, no, but it was my gesture.
Oh, that's so lovely. Thank you very much.
Thank you very much for it.
You're welcome.
Thank you.
Take care. See you soon.
Mr. Adaway. Roy Adaway. Sorry for the delay. Come on, have a seat. So, it's been a while since we met up.
Yes, yeah.
So, how are things with your back pain and...
Still terrible. Absolutely terrible. Sometimes I don't sleep for a whole night or something, you know?
Main concerns were with respect to your pain relief. And I can see the King Edward's Hospital Pain Clinic invited you for the Living with Pain course.
Yeah, I could only make
2 out of 9 sessions.
Yeah.
Why was that? What happened there?
It's getting there, and you sat there for a couple of hours. I know you have a break, but sometimes the pain just, well...
I would seriously advise you to attend that.
Yeah, well, I got a letter from them saying they will invite me back.
That's right. One of the main concerns from the pharmacist who was reviewing your medication was that you had a slurred speech, and it was also concerned about the tramadol usage. So what do you think about your overall tramadol usage? How much are you taking nowadays?
Well, up to 8 a day. Sometimes if I wake up during the night or, then I'll take a couple more to try and, help me.
Yeah, 8 is the maximum though.
Yes, yeah.
One would advise, not more than that.
No, I have taken like 10.
I would certainly advise you to cut down on that.
Only very occasionally.
Any other substance that you're using that might cause you slurred speech and confusion at times or anything? Alcohol?
I have a drink now and then, not excessively. I don't do any,
Any other drugs, yeah.
No, not recreational drug taking or nothing like that. Never have done.
You smell of alcohol. Have you been drinking?
Ronald Booth, please. We're upstairs. Is that okay? Yes, just the nurse. Come in, take a seat.
Thank you very much.
Come on through. Sorry, it's a bit warm in here. How can I help today?
I still have the pain with the passing of water.
Right.
But it's not as bad.
Okay.
And the tablets run out today.
Right.
And he gave me a 7-day course.
Yes. So how much better is it?
I'm going to the toilet both obviously both ends, and my wife's giving me lots of fruit and telling me to drink lots of water, and that's helping as well as the medication.
So you said it was a bit better. Is it, what, 50% better? Or?
About 50, I would say.
OK, fine. And do you keep needing to go still?
I keep getting the urge.
No blood that you've seen?
No bloods, no.
OK.
But I did, I know I shouldn't do it, but looked at Google.
I did tell you
and I looked at this. I don't know whether that would help.
I have to have never heard of these before. I mean, it does sound very convincing of a urine infection, which is the most common cause of those symptoms.
Yeah.
And the fact that you have had some improvement with the antibiotics would also suggest that it's probably infection, because if it wasn't, I don't think the exactly wouldn't have made any difference.
I did wonder whether it could be stones.
Generally, with stones, you get a lot of kidney pain on one side. And kidney stones wouldn't improve with antibiotics either. So I think, all in all, I'd probably recommend extending the course of antibiotics, because you're almost there, but not quite. So I think probably another week should do it. Drink plenty of fluids as well. If you're still not better by the end of the course, it's probably worthwhile seeing us again. Is that OK? All right.
Thank you very much, Dr.
Yeah, I've had 2 drinks today.
2 drinks, yeah. Do you drink the whole day?
No.
You're on quite a few medications. I wouldn't advise you to binge or take alcohol excessively. How much are you drinking daily basis?
I might have, well, I've had 2 today.
2 pints of beer, or?
Yeah, beer, yeah. Not strong stuff.
Clearly, that's something we need to keep an eye on.
I am under some pressure at the moment, financially.
OK.
And stuff, and I'm starting to feel...
That's taking an effect?
Yeah, you know. I have some dark days sometimes, you know. I'm under increasing pressure all the time. You know, trying to sort out where I'll be.
Yeah.
Maybe in 4 or 5 months' time, you know.
OK.
Whether, you know, I can stay on where I live or whether I've got to go to the council.
OK.
And beg them for a place, but that's not easy these days, is it?
Yeah.
I mean, no one's going to employ me. I've applied for some jobs in the past. You're lucky today if you get a reply, you know, from the company.
Right.
So I just feel washed up, wasted, and stuff, you know, and it's really putting pressure on me.
True.
I don't know what to do, really. You know, I feel like I'm trapped.
Shall I arrange for some talking therapies to help you with?
I probably can do with speaking to someone. I think, well, it's going to be a help to me.
Fine. Let me arrange that for you. We will keep an eye on the usage of the tramadol, and we will try supporting you with your pain and your mood gets better, OK?
You know, I'm worried about both.
That's right. And I would regularly see you from now on. All the best, sir.
Right, lovely. Thank you ever so much.
Good to see you after a long time.
I'm going to go back home now.
Keep moving.
Yes.
All the best.
Yeah.
Take care.
Okay, Doctor.
Bye-bye.
Bye-bye.
Cheers.
Good afternoon, Final Road Surgery. You're through to Gagan. How may I help you?
I'm going to put this in a nurse Monday morning, please, for a B12 injection.
So look what we've got.
That was my shoulder. But now my legs are killing me. I'm dragging them about. It's just, you know what I mean? It's breaking my heart. I just can't move.
Colin Carter Senior. If you could just jot it on my card, I'll be happy.
So they just keep giving me back in here, more blood tests, more blood tests. Yeah, that's fine, but we'll do another blood test. We'll do another one.
No, that's fine. There you go.
Thank you kindly.
You're welcome. Hi.
I'm Dr. Shree. Have a seat.
Right. What it is... Oh. I need a written prescription. I've just come out of, from Wexham yesterday. I'll show you, let me show you what the problem is first before I start. Oh, I'm in agony here, I tell you. We've got all that there.
OK.
All that there.
Right. When did it come up?
When did it come up? March. I had loads of little bubbles to start off with. And I went to, because I've got leukemia. I've been diagnosed with leukemia since 2006. I was in Oxford for 4 weeks in 2011. I was told I don't have the transplant. I've got about 3 years left. And
Sure.
Because in the end, I had to have a bone marrow transplant. And everything was all right for about a year, and then it come back again.
Has he been quite upset and miserable otherwise, or has he been coping with all this quite well?
Quite well.
Yeah?
He's happy.
Yeah, he's quite a happy baby.
Happy, yeah.
Okay.
The thing is that he might scream, like, he don't want the ball, and the next minute he's like, and you try and put the ball there, and you push it away.
I do think you're such a happy baby, aren't you? Yes, you are. Okay, well, best of luck.
What's wrong? What's the matter?
Very beautiful now. They get harder work when they get older, don't they? Good luck. Bye.
Come in, have a seat. Hello, I'm Dr. James. Morning, morning. Come in, grab a seat. Now, what can we do with Rhoda then?
She got burned. She burned her leg.
And how did she burn her leg?
She pulled the kettle.
Oh, right, okay. Where was the kettle?
The teapot. I mean.
Oh, the teapot. Oh, right. Was it on the sort of table or where was it?
Floor.
On the floor.
Yeah.
Oh, right. Okay.
So I was concerned because of an infection.
Shall we have a look and see then?
Yeah.
Yeah. And let you take it off. What's this from? Okay, so they are nasty burns, but they're not infected. And you've sort of done a good job because they are beginning to sort of seal over.
Yeah, because 2 days I opened it and
Yeah.
I left it under.
Yeah. If you've got some Gelinet, it's worth putting a little bit of some Gelinet on again. What we ought to do is just check them again in about 2 weeks to make sure it's all settled down. I think this looks like a little reaction to something. You can see there's some little.
Just now.
You could give her a little bit of Piriton solution, which is an antihistamine.
Antihistamine.
Yeah.
Okay, so.
I'll give you some of that. But I mean, obviously, teapots and stuff, you need to make sure that they're well away because at this age.
I just said to my husband that I'm gonna make another tea.
Yeah.
And I got up and she pulled it.
Yeah. Okay. Obviously, try and keep it out of your way because you're very inquisitive. Is she crawling and stuff at the minute?
Yeah.
What I'll do is I'll just get something just to cover that for you. Sorry, sweetheart. There you go. There we go. You're just put Gelinet on as you've been doing that. Okay. With this, it's just 2.5 mils, half a teaspoonful, up to sort of 3 times a day, just to try and help with that little rash that's obviously she's reacted to something. Okay. Not at all. Take care then. Bye-bye. Bye. Have a good day, you too. Bye-bye.
Anyway, my back ballooned up like really big round blisters.
Yeah.
And within those 2 weeks, every time I was trying to get some sleep, my back was popping like bubble wrap. Every time I lie down in bed, I was in a right mess.
Yeah.
Have you ever seen shingles like that before?
This is one of the worst.
That's what they will say.
There's been a secondary reaction on your skin, it looks like.
Anyway, they put me on so much medication and I went back to Whitson yesterday. Yesterday I was given it's a cream.
Yep, capsicum.
Do I just apply this to this?
Did they say not to put it on the shingles bit? I think you can.
I can.
Yeah.
It's going to be iffy.
It is a pain relief cream.
Oh, it is, is it?
But it's based on pepper, on chilli.
He warned me about that.
It can burn a bit, but...
It smells... Excuse me. Also, since I had this, I've been coughing up a lot of phlegm, as you can hear.
Yeah.
Is that a chest infection?
I'll have a listen.
Yeah, it's only since I've had this. God, I've been killing out so much muck, is the polite way of putting it.
I'm going to check your temperature. Just put this in your ear. What colour is it when you cough?
Oh, it's just white phlegm sort of thing.
So that's normal for you, that colour, is it? Okay. So it hasn't changed?
No.
But do you think it's more productive, this cough? Okay.
Sometimes in the evening, watching telly, I have to have an old disused cup by my side in the chair because every time I cough, otherwise I'll be walking back and forth to the bathroom every 2 minutes.
Okay. So, sorry, continue my examination. I'll listen to your chest, if that's all right. Some deep breaths for me. If you breathe in and out through your mouth for me. That's great. It's painful when I...
Yeah, it's a nightmare when I have to put a T-shirt on and off.
Okay. Fine. Listening to your chest, I mean, the good news, oxygen is great. You haven't got a fever. But with the vulnerabilities and the fact that you're on steroids as well now, I think I would agree to cover you with some antibiotics. So that's there to, in a way, to protect you from these sort of situations, from deteriorating. But I will give you something called clarithromycin for chest infection. All right, that's there.
Right, okay then.
All right.
Right.
Okay.
Thank you very much.
Take care.
Thank you.
Bye.
Hi, Connor. Come and take a seat.
Thank you.
How can I help, Connor?
Like past week, I haven't been able to sleep at night, like at all, and like my uncle's he gave me like he got prescribed some Valium and he gave me one.
Your uncle gave you a Valium?
Yeah, like I had it before, but they gave it for my back, but it helped me sleep before. But it didn't affect, and it's really annoying.
How many tablets did you take?
Just one.
What we say is, because you're very young, you're only 21, we don't want you to become addicted to these tablets. Borrowing other people's medications is something that we don't recommend, because if it's out of date, if it's not for you, you know, you're quite young. And
Nah, he was just trying to help me out.
yeah. So just to double check, have you had insomnia before where you can't sleep?
Nah, this is like the first time.
And in this last 1 week, what do you think might be causing this?
I don't know. Well, I've started a work experience thing where, like, I start at 4 and finish at 10.
What work experience are you doing?
It's warehouse working. So you think that would make you tired? But
Yeah.
like, I just can't sleep.
And your mood this week, you've not had any recent low mood or previous depression, anything like that?
No, I'm a happy guy.
You're quite happy?
I'm not like, I don't get depressed or nothing like that. No.
And alcohol and smoking, do you do those?
I don't smoke, but I occasionally drink, but that's like when I go out with my friends.
Sure. And do you take any other drugs?
No, I don't take anything.
What I would suggest is, drink lots of water and do something we call sleep hygiene. Get to sleep at the same time every night. Go to bed only when you are tired. Sometimes exercise is good, but not exercising too late in the evening. So with this new job, because it's kind of in the evening, it might have been changed. It's probably changed your kind of routine. Yeah.
Yeah.
What we could do is you can try things over the counter, or I can prescribe you something which is very similar to Nitol, called promethazine. It's the least addictive medication to help you sleep, and I can just give you, 4 to 5 tablets just for the next couple of days to help you out. You just take one at night.
Yeah. No,
Would you like to try that?
Yeah, that's fine.
There you go.
Thank you very much.
Okay. Don't take any more tablets, any prescription tablets of other people.
No,
All
don't
right,
worry,
then.
I won't. Hopefully I'll be sleeping properly soon. That's all right. But
Take care, bye.
Okay, thanks very much.
No problem, you take care, okay?
Thank you.
No, that's for you. Fantastic stuff. You're welcome. Good luck. Okay. Cross your fingers.
Thanks for coming in. Okay, panic over.
No, panic over.
Panic over.
All right. Nice to see you, Mrs. Davitar. All the best. Yeah. Bye.
That's lovely, thank you.
All right.
Ready for a dance now? All right.
How can I help you?
I press on there and that's sore. Yeah, that's very sore. Okay. Yeah.
Is it all right if I have a look at your chest?
You're so good.
No.
It's fed up with just being in pain all the time. It's just getting to the point where it's just... I'm so sorry.
That's all right. I would say that means there are some issues with your memory. I mean, it'd be quite good to have a chat with your wife sometime.
She reckons it's close to dementia. Still there on the end, red. I tried Germany, Jesus, what? Not a good idea.
Good morning, Horford Health Centre, Sally speaking.
Morning.
Morning.
Come on in. How are you doing?
Arm. I don't know what's going on. It's been like it since the beginning of March. I thought
Okay.
maybe I'd sort of muscle thing or
Yeah.
anything, but I can only sort of move it so far.
We can certainly have a look at that.
Right, okay.
Okay.
Okay, going up is fine. The side, and it goes
Yeah.
that far.
And
then
whereabouts exactly is it painful?
it's
Just
like-
in the main...
Yeah, it's like, can't really pinpoint it, to
Is
be
it in
honest
the
with you.
elbow? Is it sore in here?
No,
And it's not sore when you move your forearm, it's sore when you move the top bit?
no.
That's okay?
Yeah.
Pull me in.
So I can feel something there.
Okay, and does it hurt as you go up the back, like doing a bra strap and stuff?
Yeah.
If you push me up here, does that hurt?
That does.
Okay. So that's the thing, that's the movement that brings it on.
is, yeah.
Just relax now. If I move it, is it less bad than when you move it?
Yeah, it's less bad.
It's less bad?
It's less bad.
Okay. It's good. So that helps me to figure out what's going on.
Oh, good.
So I think what you've done is injured one of the muscles around the shoulder that comes down into the back here. And it's called your infraspinatus muscle. And the reason I can tell that is because there's one movement that brings it on particularly, and that's pushing up against me here. And that is the muscle that's used to do that action and to move your arm around. The other thing that is making me sure that it's that is that when I move it, you're not having to use any of the muscles, obviously.
no.
And so, but it shows that there's nothing in the shoulder joint that's causing the problem. I think probably that this will just settle down
Right,
with
okay.
some time.
Yeah.
And I think that probably we're going to get away without needing to do any physio if it's not causing you too many problems. I would suggest that you try some ibuprofen 3 times a day, for maybe up to a month,
Right.
would help to settle that down. And then I'll see you again, and if it's still bad at that point,
Okay.
we'll get you some physio for it.
All right, okay.
Does that sound like a reasonable
sounds
plan?
good.
So yeah, try that plan and just keep gently exercising. One of the things that you can do for your own physio is to put your arm out here and write the alphabet.
Oh,
So,
really?
okay, so you start off small, A, B, and if you just do small letters first,
Okay.
C, D, and then later on in the week, do it a bit bigger, A, and then by, a couple of weeks' time, you can do really big letters.
Okay.
And then if you do the alphabet twice a day, morning and night, but just getting bigger and bigger letters, by the end you'll be doing huge ones.
Right, okay.
And that's quite a good way of just
Yeah.
getting some of the physio done for your shoulder.
Right,
so
then, I will
do your
do
own
that.
exercises
I will
with the ibuprofen.
Do my own.
And then
yes.
we'll see you in a month's time if it's
Right,
not settling
okay.
down.
Good.
So, hi, and what's your name?
Susie.
Susie. Hi, Susie. How can I help?
Past few days, she seems has like sort of flash heart and then red cheek, and she had sort of like a cold sore in the mouth.
So this started how many days ago?
It's about 3 days.
Yeah. Has she been eating and drinking normally?
She's drinking,
but
she's not really
eating.
eating.
She's not eating much. So, Catherine, how are you feeling?
When I just washed my face, it's too hard. It just hurts.
What does it hurt, lovely?
The little.
Hurts the little thing on your lip. Okay. Outside of this being sore, is there anything else owie or hurting at all? Anything else sore?
My throat.
Your throat's a bit sore. Let's have a little look at you, if I can, darling, and we'll have a little look and see. Because I'll just put little gloves on, not because of you, because of my hands. Okay, lovely. Let me have a little look. Open wide like that for me. Now give me a really big ah.
She's ah.
Tongue right down for me, darling. I'm going to have to just tickle up the back there, darling. Sorry, love. Her tonsils look pussy again. I'm going to just lie... Can I lie you down, darling? Because I'm just going to make sure that I've got some swabs, because I'm going to take 2 swabs. One viral swab for the little ulcer, because that looks virally, but her tonsils look really white. You know, like they've got pus on them. What I'm going to need to do then is I'm going to have a little look at the back of that throat and then open wide. Right, it's a bit bright on that, so that's it. Perfect. So you close your eyes for me. Catherine, you're being ever such a very grown-up girl here. That's it. And open wide, wide, wide for me. Give me an ah. Say ah for me, love. Say ah, ah, ah.
Ow.
Sorry, darling. What I'm going to do is I'm going to just now take a little tickle at the back, so it won't be like my finger. So if we just do the same again, it's just like a little cotton bud. So if you just open wide for me, darling, you're being ever such a brave girl.
Yeah.
Right, that's all done. Sorry, darling. Okay. I'm so sorry, Poppet. It's really mean. I'm so sorry. You're ever such a brave bunny. That's it. Good girl. I think she's got a bacterial tonsillitis again. And her breath is smelly, isn't it? I think you're a very brave girl. We'll send those off. So I think the throat is the problem. Yeah. And I think the ulcer could be related to it, but not caused by it, in a way. OK, we're going to give you some medicine, all right? And it's really important to take the full course. It's tedious because it's 4 times a day and for 10 days, OK? So I would make an appointment to bring her back to see Jane Gosh in about a week to 10 days. I will send both those swabs off, though, OK? So definitely get that tonight with the chemist. Yes. And lots to drink, OK, lovely? Make sure you're drinking lots of water like you're being a really good girl. You are very brave. I hope you just feel better soon.
Thank you very much.
Thank you, Susie. Thank you. Thank you. Bye, Annie. Bye.
Hey, do you come in? You all right?
No, not really.
What do we need to discuss?
It's my memory.
OK.
I had a row like with the missus last night over some stupid thing. And 20 minutes later, I didn't know what the row was about. And she asked me to put something by. I put it by. Then she asked me then a couple hours later, that thing I gave her, like, where did you put it? I couldn't remember where I put it. You know, it's things like that.
Is this something that's come on fairly recently, do you think? Or
no,
has it been going on for a while?
I've been going for a while, like. I mean, I told her...
I think I've had a previous letter from the hospital where someone said they were a little bit concerned about your memory.
I told a specialist, and as you know, I've just seen her. And she said... your memory loss and what's called is probably due to depression, whereas you worry about your mother's death, you worry about your memory, you know. Well, I do get depressed.
So I think there was some concern about your memory before your mother's death, wasn't there? Actually?
Yeah.
Have we done a memory test with you at all?
What was that?
Just a test to try and assess actually how bad your memory is. Have we done a check at any stage?
No, I haven't. I can't remember.
Can't remember one. I was about to say that, but you said it for me. OK, shall we do that today?
Yeah, it's fine.
OK, and then we'll chat about where we go next. So I'm going to give you a name and an address to remember. OK.
Right.
The
Not
name,
too long, though.
Not too long. John Brown, and he lives in 42 East Street, Bedminster.
42 East Street, Bedminster.
OK, give me the whole name.
John Brown.
Yeah.
42 East Street, Bedminster.
Super. OK, I'm going to ask you that again in a minute, all right?
Right.
Romaniac, please. OK, all right, you've been in the wars? Yeah. All right.
Good pronunciation.
Oh, was it? OK, yeah, good, good. All right, good. That's good. Right, so you were in yesterday.
Yeah, I was in yesterday.
With toe problem.
Yeah.
And the doctor suggested you go and get it x-rayed. Have you had it x-rayed?
I went and they were really busy, and the bloke looked at me and had a look at it quick, and he said, I'll just go and have a look at the x-ray you had 2 months ago. And he said, yeah, I can't see anything. You're going to have to go back to your doctors.
OK, let me have a little look then, just to try and see what's going on. It was 2 months ago.
Yeah.
You were playing American football, fell over, landed on your big toe. But you had an x-ray at the time, and you were told, OK, still unable to run or put weight through toe. Is a PE teacher, so affecting work, obviously. Dr. McLaren examined you yesterday. He thought it all looked normal, and he suggested re-X-ray to confirm no missed fracture. OK, let's have a look.
Yeah.
OK, all right, which foot are we talking about? Your right foot?
One, yeah.
OK, all right then. OK, if you want to hop up there and have a look. So this is now, we've just agreed, it is 6 weeks, yeah? That's just important because a soft tissue injury, my pat line is 4 to 6 weeks.
Yeah.
Now, you're not quite at that yet.
OK.
OK? Now, I don't know if you've been resting it.
I have, yeah.
Okay, so whereabouts now is the pain?
If I press in here, it's like excruciating, right underneath there.
Okay. I'm not pressing hard enough, or is that...
It's like where you had it there, like underneath.
Just under here, yeah. So it's a little bit warm, it's a little bit swollen. Okay. So how long did you take anti-inflammatories for?
Probably the first couple of days.
Okay. Right, well, I agree with you, it's a little bit warm, and it's a little bit red, and it's obviously still sore. So you get your things back on, and let's have a think about what we're going to do. Okay. Okay. Right, so you put your...
It's just one of these things, because sports is my life, and, like, I'm sitting at home feeling like I'm getting fat, I'm getting, like, depressed over it, and I can't, like...
Okay. First thing, is that, 4 to 6 weeks, you're not quite at that yet, OK? So what I would do now is take anti-inflammatories and then book in to see Dr. McLaren in a routine appointment for maybe 10 days, 2 weeks' time.
Okay.
See if it's improving.
Okay.
And then we can take it from there. OK?
No problem.
Is that all right?
Yeah.
Sorry. I'm sure you get through.
Right.
I'm sure you'll get there.
Yeah.
OK? Don't run before you can walk, literally.
Oh, yeah.
OK?
Thank you so much.
OK, all right then. I hope it settles down soon.
Yeah,
all right,
thank you.
bye-bye.
Bye-bye.
What was that name and address I asked you to remember?
Brown.
What's his first name?
Brown. East Street. I can't remember.
I can't remember his first name. Do you remember what his address in East Street was?
No.
No? OK. And do you know where East Street is?
That's Bedminster, isn't it?
Bedminster, that's right. Very good, yeah, OK. Now, without looking at the watch or clock or anything, can you tell me what the date is today?
No. 10th.
10th of what?
Of June.
OK. And the year?
2017.
OK. OK. All right. Now, a little drawing exercise here now. This is a circle. OK.
Yeah.
I'd like you to imagine that that is a clock face. Can you put the numbers around the clock face for me? OK. Now, if the time was 10 to 2, where would the hands be? Could you draw the hands in on your clock?
10 to 2. 10 to 2.
Have you? OK. That's the end of the memory test. There were some gaps in your memory. I mean, obviously, you struggled a bit with the fellow's name at the end, John Brown.
John, that's it.
Yeah. And you did struggle a bit with the clock, actually. But
12?
Well, no, but not putting the numbers around the dial. I don't know if you...
Oh, right round, you mean?
Yeah.
That's why you do it like that.
Yeah. I would say that means there are some issues with your memory. I mean, it'd be quite good to have a chat with your wife sometime and see how she perceives it.
What she reckons is I'm close to dementia. I just go into dementia. Okay. It's stupid, isn't it?
Okay. But I'll have a chat with her sometime. What we normally do if people have got problems with their memory is there's a set of blood tests that we do, which just occasionally help us to know what's going on. We normally get a scan done of the head as well, CT scan of the head. I don't know if you've had a CT scan for your epilepsy at all, have you?
No. I've got so many tests I can't remember.
And it will also be useful from an epilepsy point of view as well. So we get that scan done, we get the blood test done.
Yeah, I've had a few fits.
Yeah. And it'll be useful to meet with your wife next time, actually. Book a double appointment and come with her. All right. You'll get an appointment through the post for a scan.
Thank you.
OK. And when you've had the scan, give it about 10 days and then book an appointment and come with Liz for a double appointment.
Right.
OK?
Yeah, thank you, Doctor.
Jolly good. Okay. Bye then. Now, I'm Dr. Jewell.
Hello. And this is Mummy, isn't it?
Yeah.
Usually I ask that, but we know that already. What can we do for you?
So I brought her in about 4 weeks ago because she had a really nasty cough. But she was fine in herself. She was running around, so I didn't think it was that big of a deal. But it turned out she had a chest infection. So she had some antibiotics for 5 days, and the cough went away for about 4 days, but then she must have got another virus. So she's been coughing pretty much on and off since then, but I've noticed the last 2 days she's been coughing up some pretty disgusting things again, haven't you? Yeah.
What's she been like in herself?
She's generally quite an ill child, but she does tend to just crack on. So, yeah, she's been running around, she's been going to nursery. We've been on holiday, haven't we, last week?
Where did you go? Do you remember?
Yeah.
Do you remember? Was it
Tenby.
Tenby.
Tenby. Do you know, I've never been to Tenby. Everybody says it's really lovely. OK, let's have a look.
Let the doctor listen to your chest like
Emily,
last time.
is it all right if I have a look at your chest?
You were so good
last
time, weren't you? You were
Why,
super
sweetie?
good.
What's the matter?
Oh, she doesn't go on.
Sophia, what about if Sophia has hers listened to?
Well, let's do this. We're going to listen to Mummy's chest. Then we're going to listen to Sophia's chest. And then we're going to listen to your chest. Excellent. Very good, girl. Can I have a listen at the back?
Can you see?
There we go.
I can see a bed.
Can see a bed? Do you think the doctor has a lie down?
I have been known to have a doze in the afternoon. To have to make sure somebody wakes me up in time for surgery.
Brilliant.
One last thing, just to feel under your chin. So just...
What do you think's under your chin? Do you think there's...
No, sweetie. Come here.
Sit on my lap.
Sit on Mummy's lap.
You're being so good. Do you remember Mum
Emily.
said if you're super, super good, you might get to have a token when we get home? Yeah? How many tokens have you got at the moment?
I want you to give me your hand. Thank you. Do you want to put your hand on top of that? Do you ever play this game? Now listen, all I want to do is to feel here, sweetie. There, that's lovely. That was all. I'm finished now.
Good girl.
She's fine. I'm not going to give her any antibiotics.
Okay.
Her chest sounds clear. She's not struggling to breathe.
Brilliant.
At all.
Okay.
She looks well.
Yeah.
I think it's interesting that you're worried about her.
Yeah, I think it's because I missed it last time.
Ah, yes. So you feel a bit, you know.
Yeah,
Yes,
yeah. Bad, and then...
So that's one. So that's a perfectly sensible explanation. That is. So you know, until they're about 12, this is what happens.
Yeah, and this is why I do tend to just leave it. But I think because it got bad last time, I felt a bit.
But while everything else is okay, while she's not struggling to breathe, and she's normal temperature, no, don't worry about it.
Okay, fantastic. There you go. That wasn't too bad, was it? You going to say thank you?
Thank you.
Oh, good girl.
Emily, it was a pleasure. You were a really, really good patient. I don't know what your mum was being so good and helpful. And Sophia
has done a fantastic picture.
Time to go home.
Yeah, let's go home. Thank you very much.
Pleasure. Bye-bye.
Yeah, you still got it. Say bye. Say bye-bye. Can I help?
Stand away because I'll trip all over you.
Where did that lot come from? They said it was going to be heavy.
Though.
No, but they said if it's going to be heavy, it'll just
absolutely.
chuck
We'll
it
see how
down.
waterproof it is. Thank you. Can I have Peter my prescriptions, please?
Yeah.
Have a seat.
We'll sit over there.
Yeah, I'll be all right.
Right, what can I do for you?
Stressed out from work.
Right.
I did ring them this morning, tell them what the problems were, which was a long list I give them. I said I just want time out. So I've also been snappy with my wife as well, coming home. Unbearable. And just shaky as well.
Okay.
You're
not sleeping either, are you?
No, I was up at 4 o'clock this morning, which was unusual.
So how long's this been for?
A couple
of weeks you've been
Yeah, 2 weeks, I think.
Right, okay. And what's brought it on, do you think?
Stress at work, plus when I'm going home, I got to care for my wife as well, just getting too much.
He's near to tears, because you can see that, aren't you? Hey, yeah.
Okay. And it's okay if you want to cry. Yeah. Sometimes it does us good. When you say you've got to care for your wife if you've got medical problems.
Yeah, I've got very bad arthritis in my legs, and there's things at home that he has to do for me, and at the moment, you know, stupid things like I can't get to the shop, so we need a loaf of bread. He'll come in and say, oh, we need bread. And the balloon goes up. Okay. At the moment, because he's snapping at me, we haven't got that relationship. We've got a very good relationship that is like, well, what have I done?
Okay.
I'm stuck at home 24/7, you know, and it's like, isn't it? And I mean, we've had our holidays, not as though you need... I mean, we're only, what, just over a month ago we were in Portugal, so it's not as though we... It's not like him. Normally, if I say, could you do this for me, he does it, and it makes me feel guilty, because he's stressed.
Yeah.
And it's like...
Okay. Okay.
Running a little bit behind today, hopefully not too long.
God, it's been non-stop today.
Come on, what are they doing?
So I'm running late, it's Dr. Ahmed, OK? About 20 minutes.
Give me 1 second and I might be able to do something for you. Be with you just for a sec.
Oh. Hi, can I help?
So you're under a lot of pressure, at home. And what's the stress at work?
Well, explain to the doctor what you do.
I'm a driver carer for adults with learning difficulties. I enjoy the job, it's not a problem, but they've been putting me under a lot of pressure, changing what I'm meant to be doing, not informing me, and things like that.
Sometimes things just hit the limit, don't they? So what do you think will help at the moment?
Time out, time away, and just potter about or go out or...
Yeah. Why don't we give you a couple of weeks off work and come back and see me in 2 weeks to see how things are having had time out? Yeah? Okay. So there's a sick note for 2 weeks. We can always extend it, so don't think you've got to go back in 2 weeks, OK? Take this to reception to book a follow-up appointment with me, so then I can follow you up in a couple of weeks, all right? OK, things will get better.
Right, OK, thank you.
No problem.
That's it. Thank you.
Have a seat.
Good afternoon.
Good afternoon, I'm Dr. Jewell.
Right, I think I've got an ear infection because I can't hear properly this right ear.
You can't hear properly out of it?
No, everything's...
It's not because it's hurting?
It's like being underwater, as such.
You had it before?
No.
OK. How long has that been going on for?
Since first thing Monday morning.
Let's have a look at this here first. Yep, that looks fine. That one looks all right as well, which is a bit of a disappointment. You've got a little bit of wax in there, but nothing that's obscuring it. Now, hold on. Somewhere in here, we have a very old-fashioned piece of medical equipment. Have you ever seen these things before?
Yeah.
OK, can you hear that?
Yes.
If I put it there, can you hear it?
Very faintly.
Is it louder there or there?
There.
Good. Louder there?
Yes.
Or there?
Louder there.
OK. Can you hear it on one side or the other?
Hear it more on the left.
OK. We're going to do a very crude test. I'm enjoying myself. Now, what I want you to do is to turn and face me, and we're going to do a crude hearing test.
OK.
I call out numbers. You call them back to me so I know you've heard them properly.
OK.
Put your left finger in your left ear. 67.
67?
32.
32.
Your hearing's all right. Don't know what makes it.
It's very, very quiet.
Yeah, OK. Other ear, but I think there's no problem about this. 86.
86.
23.
23.
And that was easier to hear?
Yeah.
Yeah.
A lot easier.
Yeah. Now, that's a very crude test, but it's good enough to satisfy me that we don't need to worry about this, but we can afford just to wait and see what happens. Have you had a cold or anything that would explain it?
No.
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 Okay. I think it might be sensible just to wait and see what happens.
Okay.
Give it a few weeks, and then if it's still bad, try out there.
Okay.
All right.
All right. Thank you very much.
Pleasure.
Thank you.
Bye-bye.
I've grown up with that. My dad's like that. He makes tea exactly like David. And, you know, if you go somewhere, he needs it in a teapot, needs the milk separately and hot water separately. So in cafe, you know, in Costa Cafe or whatever, it can be quite proper.
How are you getting on?
Pain.
Pain?
A lot of pain. It's just getting stupid.
And is this the pain that we were talking about before with your tummy, or is it different?
Same.
No, same
Just
pain.
getting more and more intense.
And this has been going on for a long time, hasn't it? Have you heard anything more about the referral that we made to the gynaecologist?
Yeah, I've got a letter through for a choosing book thing.
Oh, good. Because actually that's part of what we need to do, isn't it? From my point of view, I'm wondering about if we can just keep you going until you get to see them. Is that with some painkillers? And then we'll see what they've got to say about what they can do.
It's fed up with just being in pain all the time.
Is there anything else going on that's making things worse?
It's just getting to the point where it's just, like, you just feel like you can't be bothered to do it anymore. You know, I don't get a lot of sleep as it is anyway with my second youngest, because he's insomniac and other things. But it's just, like, the pain on top of it, it just makes, you just get up in the morning and you're just like, I'm so sorry.
That's all right, here's a tissue, look.
Thank you.
Why do you think it suddenly got on top of you? Has anything else been happening?
No, it's just getting, like, the pain's just getting more intense, more frequent. And
What are you using for the pain at the moment?
I take cocodamol, and then I take 2 tramadol before I go to bed.
That's right, I remember you saying that before.
Amitriptyline.
Yeah. Are you taking any anti-inflammatories?
I can't take amitriptyline.
Why is that? Why?
It makes me bleed even more and gives me
Does
even
it?
worse
So it's
tummy.
actually that settles it, sets it off.
Yeah.
And what about the amitriptyline? What dose are you on of that?
Well, 2 some nights, but I have been putting up to 3, like you said.
Because that's a very reasonable thing to do. Has it made much difference? No. Because it makes that tricky, doesn't it? Because you're basically on the full dose of all the different painkillers that we've got, especially if you then can't take one particular class of them. In terms of medication, the other thing would be to try some more, you know, something stronger on top. But I think I remember you saying that if you tried other stronger opiates, then it just made you feel really sleepy in the day. Was that right?
If I stopped taking the tramadol, it was like I was like a heroin addict or something. Like I was proper like shivering, I felt all fluey and everything.
Maybe then the best thing is for me to write a letter to the gynaecologist asking for them to see you urgently and just pull it forward that way to make sure that it's going to be quick. Because the problem is I don't know, based on how long the referral date will be, whether it is going to be 2 weeks, in which case maybe we can just carry on waiting for it. Or if it's 2 months, then obviously that's too far away, isn't it? Shall I drop them a quick line and just make sure that that's pulled forwards? And I'm going to see you in another week or two just to double check on how things are going, but mainly just to talk again about how you're coping with it all, because it's obviously really difficult for you, isn't it? Have you got any other support? Who else is at home helping you out?
It's just me and the kids.
That sometimes makes it really tough, doesn't it? And of course there's no magic fix for those sorts of things.
Yeah.
Sometimes there are some charities that are available that will give you extra support. The Citizens Advice Bureau can give you advice about where to turn as well when they're looking for these sorts of things. So they may be worth an appointment. Do you know who I mean?
Yeah.
Have a chat with them about whether there's anything else about that, and I'll see you in a couple of weeks and I'll get on and do that letter for you.
Thank you very much.
All right.
Thank you.
I'll see you soon.
Very good manoeuvring, thank you. A lot of practice over the years.
Yeah. OK, coming in. And are you a carer or a relative?
Carer.
Yeah.
Carer.
OK. So you think you're having a bit of a flare-up of the MS? Yeah.
Yeah.
And what happens normally when you have a flare-up?
I don't know, it depends. I get different symptoms, but always one leg or both is affected anyway.
Okay.
Sometimes my arms.
Yeah. So overnight and this morning, it's the
Yeah.
right-hand side that
Yeah.
just feels weaker.
Yeah.
Painful.
Really painful.
Right.
I'm actually waiting for HSCT treatment as well.
What's that?
That's the stem cells and chemo.
Oh, right, okay.
So I'm waiting for a phone call. It could be about 4 weeks' time.
How much is that meant to work?
It's got a good chance of stopping progression.
Right, okay.
So if it stops progression, I'm happy enough.
Yeah,
with that.
absolutely. That's
Again,
exciting then, isn't it?
It is. It might
So what does
be.
the actual treatment involve?
The first time I have chemotherapy, the first time for a day.
Yeah.
And then the second time I go up, I got to go into isolation for about 3 weeks.
Right.
I have 5 days of high-dose chemo.
Yeah.
The stem cells are taken out with me.
Yeah.
All the MS ones are taken out of that.
Right.
And then they're put back into
Beautifully described that. I bet the doctors told it like that to you. did
Yeah,
they?
yeah.
Yeah, no, that's easy to understand like that, isn't it?
Yeah, that's put in.
Yeah.
It's a really big thing
Yeah.
because I've got secondary progressive, so
Yeah.
I'm only ever going to get worse, but this will stop it dead in its tracks. And I won't have MS anymore. I just don't know if I'm still going to have the symptoms that I've got at the moment.
Okay.
MS. It's an autoimmune condition that affects the brain and the spinal cord. This is where the body sort of attacks itself. In this instance, it attacks the surroundings of nerve tissue and affects the messages sent along those nerves. There are two main focuses of treatment with MS. One is to treat flare-ups and relapses. This is often with steroid therapy and individual treatments looking at specific symptoms. The other way of treating it is by using disease-modifying drugs to try and prevent relapses.
Is there anything to see on your arms at all?
No, I said, but I think they're quite
there.
bruised.
Yeah, what's that from?
I don't know.
Okay. And squeeze my fingers for me. So there's less power there. Is there always less power there? No, so that's
This
less
is my
than normal.
good size.
Is it? Right, okay. What about your leg? So pull this one in. That's it. That's quite good. And try this one. So pull it out and then try and pull it in. Yeah, it's less there, isn't it?
Yeah.
Okay, so I think we need to just speak with the MS nurse, really. How quickly, you said you don't know when she'll get back to you?
No. Sometimes they get back to me within a day or so.
Yeah. Well, look, I'm here all day. You've rung up this morning. If you don't hear anything by 2:30, 3 o'clock, give us a ring here, okay?
Yeah.
And we'll reassess and see if I can try and speak to the consultant if we can't get hold of the nurse.
All right.
All right.
Brilliant.
So let's hope the nurse rings you back.
Yeah.
But if she doesn't, give me a shout.
Yeah.
Is that
Okay.
all right?
Yeah, that's fine.
If I don't speak to you, good luck with the stem cell.
Thank you.
Anne-Marie Jeffries, please.
Hi.
Hello there.
Hi.
All right.
I'm okay, thank you.
Good. You have a seat there. All right. What can I do for you today?
It's been feeling about the last couple of months, but it's been getting worse. I keep getting really bad pain and soreness, starting from the armpit and going just around there.
Okay.
I keep a check on it to see if I can feel any lumps and bumps. I haven't been able to feel anything, but it's just really uncomfortable and painful.
Okay. So 2 months pain in your right armpit, coming around onto your right
and
breast.
then just coming round on the right breast.
All the time? Was it related to your period or anything?
It seems to be pretty consistent.
Okay. And you're well otherwise, are you?
Yeah.
Okay.
Yeah.
Nothing around the other side?
No.
Periods are okay?
Periods are normal.
Not pregnant or breastfeeding?
No, definitely not.
Definitely not. Does it feel like it's your muscles or your ribs, or does it feel like it's inside?
It doesn't feel muscular. It's really weird. It's just like, and I can't really put my arm down like that because it's just like.
So it's certain
really
positions.
Sore. Yeah.
Okay. What about if you cough?
If I cough, it hurts quite a lot more.
Okay. Have you got a cough?
No, not at the moment.
No. All right. We need to have a little look. Is that okay?
Yeah.
I'll put the curtain around for you. If you want to slip your top things off.
Yeah.
Can I pop round?
Yeah.
Okay. All right. And you'll just get your arm up. Okay. Have you got the pain right now?
Yeah, it's like, so it's like from there. Yeah, it's like, hurts there quite a bit.
Okay.
Yeah.
So I press on there and that's sore.
Yeah, that's very sore.
And then it comes round a bit further, does it, as
Yeah,
well?
ow. Yeah.
Sorry, okay. Have you got pain over here?
No.
No, not at all? OK. Can I just check the breast area? Is that all right?
How are you on this lovely sunny morning?
Oh, raring to go.
Yeah.
So tired.
I know, it's weather.
Yeah.
Sleeping. Would you like a tissue? Because it's quite hot, isn't it?
Thank you.
It's so hot. I think my face has melted.
I get sweatpants in the back.
Are you getting enough to drink? I mean, the weather is very hot at the moment.
So hot. I know, it's so nice outside.
I never wish for this heat. They're lying. I like the winter.
Do you?
Yeah. Snugging up on the sofa with cups of tea and hot chocolate. Fire, blanket, I love it.
That sounds quite nice, but...
And then in the summer, it's just like, I just need my space.
Yeah.
I was like, nah. Are you all right having your blood taken?
Yeah.
Yeah.
I'll be fine.
Okay.
I think. Should be.
Okay, you sure?
No, yeah, I will be.
Yeah.
I give blood. I'll be fine.
All right, then. Which arm do we go for bloods?
I'm right-handed, so maybe I should do my left.
All right, yeah, that's fine. Whatever suits you. I just do what I'm told.
So is it checking everything? So it's just going to check for...
Yeah, you've got a bit of a full MOT going on here.
Good. That's what I need. I'm falling apart.
Oh, really?
Ooh. Yeah, I've got all sorts going on.
Oh, that's not good. Well, hopefully we can get you back up on your feet again.
No, hopefully they'll find something out. I know what will happen. It'll come back and be like, oh, you're fine, you're healthy. Yeah.
You're like, what's wrong with me then?
Something's wrong with me.
I
know.
Don't go fainting on me now.
No, I won't. I won't. I'm not really squeamish.
I find all of this quite fascinating
Yeah,
now.
I think I'd quite like,
I do.
sticking needles in people.
When I first started doing the training, I was a bit unsure, and I was thinking, I don't know.
Yeah.
Because you practice on this kind of like plastic arm.
Oh yeah.
And it's got like veins in that, and then once you go kind of let loose on patients, you're a bit like. I can remember I was doing it on one of my colleagues, and my hand was like that. I was so nervous, but then after a while, it's
quite fun.
Yeah, you just get used to it. Okey-dokes. That's brilliant.
Nice.
That is you all done. So these will be back Monday, and then you can speak to the GP about the results.
I think I'm in like Thursday or something anyway, so I might as well just wait. Cool. Thank you.
No worries.
Oh.
Have a nice day.
You too. When do you finish?
5:30.
Oh, not too bad. Thank you.
Take care. Bye-bye.
The breast tissue itself's not so sore. It is what we'd call musculoskeletal.
Okay.
That's fine. Okay, you put your things back on. Did you take up any new sort of fancy exercise or anything like that just before it started? You been doing anything weird? What's your job?
I clean, so my job's quite vigorous.
Yeah. Okay. Okay. So the good news is I can't see anything
That's
I'm worried
good.
about there. Okay. I think that is what we would call musculoskeletal, which means it's like the soft tissues or the ribs around there.
Okay,
It's not the
yeah.
breast that's the problem. Okay. What I would suggest you do is rather than taking any tablets, you get yourself an ibuprofen gel, which you can go and buy, and it's cheaper to buy. If
Okay.
that's all right. Okay.
Yeah.
And just rub that on. And then
Okay.
just start doing some gentle. Do you do much exercise? Are you sort of...
I've started playing netball.
All right, and can you play netball? It's not uncomfortable to play netball?
It's a bit
Quite strenuous,
uncomfortable,
isn't it?
but yeah, not.
Great. Use the gel.
Okay.
Continue with your netball.
Yeah.
That's fine.
Okay.
And wait and see what happens. So
Okay,
hopefully that
cool.
will just settle down.
Okay.
All right?
Okay.
If
Thank
it
you
doesn't,
very much.
I'd like to see you again.
Okay.
Okay?
Thank you
Is that
very
all
much.
right? Okay.
Thank you.
Hi.
Uh-huh.
Hi. How are you doing?
Tired. My eyes feel like peels in the snow.
Right. What do you mean by that?
They're tired.
Yeah.
They're sore and but they're just sore.
And you link it to tiredness, though?
Well, I do, yeah.
Yeah, and is that a feeling that you've had all your life when you get tired, that your eyes get like this? Or is
Only
this still...
since I started having Diabetes.
Right, OK.
Now, knackered.
So the tiredness is linked to having the diabetes. What about the eyes? Is that something is that a feeling that you've had before, or is that something?
Yeah, they just feel sore and tired.
Just not right?
No.
Is your vision OK?
Not all the time, no.
Not all the time?
Bit blurry.
When does it get blurry?
Basically when I lay down on the bed and watch television.
Yeah. And when you blink and try...
Yeah, it clears it.
It does clear it. So it does go back to normal. Let's have a little look at your eyes here. Have you been to the optician?
Not lately.
Just look up. Look down. Look left. No, double vision. Look right.
Gritty.
Feels gritty, does it? Yeah.
Not now, but it does.
So I think what's happening is that the eyes are being feeling gritty, and probably I'm going to try some moisturising drops because that's the most likely cause of them feeling a little bit uncomfortable. I want you to go and see the optician as well and just get your eyes checked over. I can't see in the back of your eyes very well, and that needs to be looked at by the optician just to double check that that's OK. And I think a lot of this is down to the diabetes, and that's what we're working on to try and control as well.
Yeah, I know. It's a murder, that is.
I'd like to see you in the next 1 to 2 weeks just to check up on the health. And if you could go to the optician in the meantime. And I've sent the drops over to the chemist.
One other thing, can I have some more ointment for my downstairs because it's not gone. I've been to the hospital twice. They said it's, I don't know, some name, but not anything to worry about. It's still there on the end, red, and I wipe it every time I go to the toilet now.
I'll give you some more.
I tried Germany. Jesus, what? Not a good idea.
Try this one, ongoing.
I thought I'd have a go at Germany. I got enough here. And I wish I hadn't.
So if you take that to the front desk, the cream and the drops have gone to the chemist. All right?
Yeah.
See the optician too about your eyes.
I'm beginning to feel I'm a nuisance.
Well, it's not something that I'm feeling, so, you know.
Well, I'm glad about that, but I get peed off with... I told you I got this, I got that, but I have.
I know. Well, that's, you know, part of the challenge, isn't it, of getting a bit older.
Oh,
I know it's annoying.
That old chestnut. Yeah, unfortunately, you're right.
I'll see you soon.
Yes, hopefully. Cheers.
Bye.